All right, Michelle, it looks like we are live streaming. Malcolm, can you see that? He must have stepped away.
Hey, should I give me 1 second?
Okay.
Yep, it's fine. So when we're ready,
Okay. And there is somebody in the chat. I will be sharing Dr. Rachel's slides. Well, we want to research over that. Yes. Michelle, can you see the chat? No, you can't see it.
Has there been anything in the chat?
No, so it was just sent to me, but just FYI, when it's time, Marina Soto, she is sharing Dr. Bajron's slides, so she'll need to be made a presenter when it's time for Dr. Bajron to give her testimony.
Okay, I'll make a note of that. What's her name?
Hi, it's Mila. I just want to make sure you all know I'm going to be working my own slides and also, oh, great, wonderful. And can you also make sure that like there's a folks can see both me and my slides? I don't know how you do that, but there's like a special setting for that you usually do.
Yes, we will figure that out. Actually, Mila, can you come on camera and start your screen share just so we can see?
Yep.
Just to make sure that that works. But Michelle, the answer to your question is Marina Soto. She's the person that's going to do Dr. Bajron's slides.
Okay, so I'm sharing my screen.
Okay, hold on. All right, so sharing your screen. I see you at the top. Hold on, let me see if I can change. Show active speaker with shared content. There we go. Okay, so that's perfect. So do you see yourself and your slides?
I do.
Okay. So Michelle, you can stop presenting media. When I switch over to you as host, Michelle, the settings should stay the same for the layout that I did, but I'm gonna switch to host now and you tell me, Mila, we may need you to present again. So let me close this. All right, where's Michelle? Change role, make host.
You said to go ahead and share again.
Yeah, hold on 1 second. Michelle, you are host now.
Okay.
All right, so Mila, go ahead and share your screen again.
Okay. Okay.
Okay, so Michelle, what you're gonna have to, there you go. It's perfect. Yep. Can you see yourself and your slides?
So I see myself on the side where I see you. That's where I saw myself last time too.
Okay, good. Because I'm right now, I am just I'm not the host, so I can see you as well as your slides to the left of you. So I think it's working.
Okay, thank you.
Awesome.
So you could stop sharing?
Yes, you can stop sharing. Yes, yes. All right, Michelle, you are host. So whenever you guys are ready, take it away. I'm going to go on mute. I'll be here if you need me, text me or call, but you guys have, and don't forget when you guys are ready to start to hit the record button.
Okay.
Morning, everyone.
Good morning.
Good morning, Councilmember.
We're going to begin in about 10, 15 seconds. How's that?
Okay.
Good morning, Mr. Chair.
Morning, how are you?
I'm good.
Good. Glad to have everybody here on this wonderful, bright, sunny
First
Monday
day of
morning.
spring.
Yeah, first day of spring. That's right. How about that?
And we deserve this wonderful, beautiful weather. We've earned it.
That's right. That's exactly right. We are deserving, aren't we? I'm going to make out an opening statement, guys, and we'll go from there. How's that?
Sounds good, boss.
Okay. Anyway, good morning. I'm Vincent C. Gray, Ward 7, council member and chairperson of the Committee on Health. And I hereby call to order this fiscal year 2023 budget oversight hearing with the DC Health Benefit Exchange Authority and the district's Department of Behavioral Health. Today is Monday, March 21st, first day of spring, as has been noted already. It's March 21st. The time is now 10:04 a.m. And we're holding this virtual hearing due to the continuing COVID-19 pandemic, which can be viewed live on the committee's youth tube page. Joining us will be a number of council members, I assume, as we go along, and we may be joined by others as well. Today is the first of our budget oversight hearings for the committee. Public witnesses will have 3 minutes to provide testimony. Council members will have 5 minutes to make an opening statement. We will have one 10-minute round of questions with HBX and with the Health Benefit Exchange Authority, and 2 10-minute rounds with DBH as well. I will call on council members by seniority on the committee of the on the committee. We, the members of the committee, will have one 10-minute round of questions. And if anyone has questions or issues, please send a message on the chat to my staff. Malcolm Cameron is with us here today, and he will relay such questions to me, either to Malcolm or to me, and our committee director, Michelle Loggins. I want to congratulate Mayor Bowser on her and her team on the hard work that went into submitting the district's proposed fiscal year 2023 budget. This year's budget has many positive elements, at least in my opinion anyway, especially in the area of health, with continued capital funding for the construction of a new hospital. Isn't that great news, guys? It is to me anyway. And that will be the center of a true healthcare system for the east end of the District of Columbia. And there will be additional support in this budget for school-based mental health and additional support for those services for especially our children who need that kind of assistance, that kind of help. As our council members arrive, when they arrive, I will then turn to them and give them an opportunity for an opening statement. And we'll then just go from there. The first agency on the agenda will be the DC Health Benefit Exchange Authority, which I established as mayor of the District of Columbia in order to develop and operate our online health insurance marketplace. Our DC Health Link, as we know it, our district residents and small businesses operate under and the Affordable Care Act, of course. Hold on just a minute. Approximately 100,000 district residents have the availability through the DC through the private health insurance process and through the DC Health Link. The program has cut the district's uninsured rate in half, and now more than 96%, which is phenomenal, of our residents are covered. And as always, I want to commend Mila Kaufman, who has been with us since the beginning. Mila, thank you so much for the work that you do, and the board that you work with, and all the other folks who are your staff who are engaged with the efforts. Her staff is engaged with a great deal of work in helping to facilitate a really close to a 100% rate of coverage with people, and they maintain a fantastic effort on the part of residents of the District of Columbia. One of the most cost-effective and state-of-the-art health insurance marketplaces in the nation, and I know she feels comfortable saying that, and I'm sure proud, like I am, to feel as proud as we can feel about the work that is being done there. I would like to use this hearing as an opportunity to examine how the mayor's proposed budget, as we move along, is being used to support the health benefit exchange efforts with respect to being available to people to get so much of our work done. Next, we'll focus our oversight on the Department of Behavioral Health, or DBH, which we commonly call it. We will hear testimony from public witnesses, then hear from Department Director Dr. Barbara Bazaran. The mission of DBH is to support prevention, treatment, resiliency, and support the district's efforts and our work to try to overcome mental health disorders in the District of Columbia. We've had to continue to try to overcome opioid overdoses in the District of Columbia, and over 40% in the District of Columbia. But those numbers are still staggering to me. This is despite the development of the Live Long DC plan, which is designed to cut deaths in half. Many of these deaths occur in wards 7 and 8. And those are the ones where we really need to continue to focus as much as we possibly can. I'd like to hear from DVH about about the programs they're currently funding in fiscal year 22 budget, and what will be forthcoming in fiscal year 23, and working to in the community to prevent opioid deaths, and how the proposed budget will further this goal. I'm pleased to see an increase of $3.8 million for school-based mental health support, which we know is desperately needed. I'm also delighted that there will be funding for workforce support and to help with these positions to support the continuing growth and expansion of work in these areas. Based on my preliminary review, the fiscal year 23 budget proposed makes great progress, and I look forward to hearing from Dr. Bazran and how these resources will be used to effectively further deploy our resources and our services. Basically, ladies and gentlemen, that concludes my opening statement, and I would like to turn to any council members, which I don't think any are here at this point. But
Councilmember, we've been joined by Councilmember Pinto from Ward 2.
okay, all right. Councilmember Pinto, how are you this morning?
Good morning, Chairman Gray. I'm doing well. How are you?
I'm good. Would you like to make an opening statement this morning?
That would be great.
Go right ahead.
All right. Well, thank you. And thank you for holding this budget oversight hearing today on two extremely important agencies to so many district residents, the DC Health Benefit Exchange Authority and the Department of Behavioral Health. As you know, I don't serve on this committee, but I'm really thrilled to hear today from our public witnesses in these agencies and how we can keep moving our city forward to be the most healthy we can be. And I'm really pleased to see significant investments in the Department of Behavioral Health and the mayor's proposed FY23 budget, and particularly with continued expansion of school-based mental health services and our DBH community response team. And thank you very much to Mila Kaufman for your continued leadership. It's really unbelievable that we now have 96% of district residents covered by health insurance, and know that we'll be working to get that number to 100% in the coming years. After our discussion with Director Bazran during the performance oversight hearings about the challenges we faced with the talent pipeline for school-based mental health professionals, I'm particularly optimistic to see specific investments in strengthening our workforce pipeline. I look forward to hearing more today from Director Bazran about her vision for those investments. We've also been able to make significant impact through our DBH programs to reduce opioid-related deaths. I'm looking forward to learning more today about how we will continue to make progress on these efforts in the coming year for what continues to be an unacceptable level of harm done by opioids in our city. The COVID pandemic has created a mental health crisis that we are only beginning to grapple with. Our hospitals have reported that the number of children experiencing mental health crises has skyrocketed, especially among our teenage girls. The rise in gun violence, I believe, is also reflective of our community struggling with mental health. And we know that hurt people hurt people. And so it's extremely important to continue making investments in our community to reduce the cycle of trauma. When we don't provide the mental health resources needed to our most vulnerable residents, violence in our streets and our schools increase. I also hear every day from residents who have concerns for neighbors grappling with mental health challenges who are on the street. And I'm hoping to hear a clearer vision today from the Department of Behavioral Health on how, as a city, we can provide more intervention and supports, particularly for our neighbors experiencing homelessness, some of whom need additional mental health supports. So looking forward, as always, to working with residents, community organizations, mental health professionals, and Dr. Bazran to ensure that the services we are providing to our residents are effective and are reaching all those in need of support in a timely manner. So thank you all, and thank you again, Chairman Gray.
Appreciate you being here. We're certainly delighted to have you participate in any of our health efforts that you want to participate, that you can participate and want to participate in. So we'll look forward to your continuing work on behalf of those you represent in Ward 2. So thank you so much, Councilman Pinto. We appreciate it. All right, we're going to begin now with our witnesses. Let's see. We have a number for the health benefit exchange. Let me call up. We got 3 or 4 public witnesses who want to testify. Is Reverend Patricia Hale Spears. Reverend, are you here?
Yes.
Oh, good. Okay. How about Barbara Kittredge? Are you here, Barbara?
Yes, I am.
All right, fantastic. And how about Angela Franco? Angela, are you here?
I am here, Councilmember Gray.
Okay. And we'll look forward to hearing your testimony also. How about Crystal Williams? Are you here?
Yes, I'm here.
All right. Well, we'll begin now with the Reverend Patricia Hales Spears, and then we'll just go down the list from there. Okay, go right ahead.
Excellent. Good morning, Council and Chairman Gray and members of the DC Council Committee on Health. I'm Reverend Patricia Hale Spears, and I'm the pastor of the Fellowship Baptist Church, which was organized in 1994 in Washington, DC. I also serve as a member of the Wednesday Clergy Fellowship, a group committed to ensuring the faith community will be informed of health issues and resources available throughout the district. Today, I'm representing the Leadership Council for Healthy Communities, LCHC, an organization for which I've been affiliated from its beginning. The LCHC is an organization comprised of clergy leaders, medical professionals, and public and community leaders working together to help African Americans and other communities of color eliminate health disparities and promote healthy communities through comprehensive health programs. I'm excited to share some of the work of LCHC that has been empowered to do through the support of the DC Health Benefit Exchange Authority. As an assister organization of the Health Benefit Exchange since its inception, we have been able to witness and partake in an amazing work of the exchange has been doing by enrolling the community in health insurance programs and raising awareness about resources available to residents across the district. With the success of the Affordable Care Act, ACA, extended by the Biden administration, many uninsured residents finally gained access to health insurance coverage. The strengthened and affordable coverage under the American Rescue Plan has also allowed us to be even more effective and expand the reach with new methods. Our commitment to the cause wasn't waived as the LCHC has persevered to continue to provide ways to reach communities through in-person and online events. Throughout the COVID pandemic, assisters have completed outreach via phone calls, video calls, in-person community outreach events. Our staff has completed hundreds of calls to assist community members in securing health insurance during and after challenging moments in their lives. Through our expansive network of clergy members, faith institutions, and staff, we continuously foster a far-reaching web of connection that allows us to engage the community on various fronts. For making ourselves available to the Metropolitan Police Department's community outreach events, to providing assistance to the Mayor's Office on Asian and Pacific Islanders Affairs Resilience and Women's Public Safety events, and the Greater Washington Hispanic Chamber of Commerce Business Expo, we've established a presence in several communities of color and continue to expand our reach. We have also continued to participate in a vital one-touch events where assisters answer questions regarding health insurance and help attendees enroll. At the last hearing, you heard of our work during the DC HealthLink African American and Faith in Action Weeks. We have continued these efforts, conducting socially distanced outreach to barbershops and salons, such as the Midtown Barbershop and John Scott Cuts. We have also continued to utilize our network of faith institutions, encouraging pastors to highlight the needs for coverage from the pulpit and beyond. We encourage our institutions to use every method of communications they have available to reach our congregations, including the use of virtual worship services, church bulletins, and programs to serve as a reminder when there is no events for LCHC's assisters to attend. LCHC offers continued support to the Health Benefit Exchange. It is an honor to be able to participate in the sacred duty of improving individuals and community health. I pray they will continue to be successful in this service to the DC residents. Respectfully submitted, the Reverend Patricia Hale Spears, Fellowship Baptist Church.
Thank you, Reverend Spears. Thank you so much for your testimony and for your work. I've been to the fellowship meetings on many occasions.
Yes.
And we look forward to continuing to work with you guys. It is a great gathering of people. And please convey to your colleagues how much I appreciate and how much we appreciate the work that you do. And we'll look forward to continuing to work with you, okay?
Thank you.
Welcome. All right. Is Barbara Kittredge? Barbara, are you here?
Yes, I am.
Okay, go right ahead.
Good morning, Chairman Gray and members of the Committee on Health. My name's Barbara Kittredge, and I'm a Ward 1 resident. I want to thank you for allowing me to speak before you today regarding DC HealthLink and the positive impact it's had on my life as I undertook a career transition during this once-in-a-lifetime pandemic. I have health insurance coverage through DC HealthLink's individual marketplace. And I first came to DC HealthLink in January of last year after parting ways with my employer. Up to that point, I had received health insurance benefits through my employer. Now, without health insurance benefits, I engaged with DC HealthLink to get covered because I was without work. I was eligible for Medicaid, which I utilized for 2 months of my unemployment. When I was hired by my current employer in August, I was given a monthly stipend for health insurance coverage. That's when I came back to DC HealthLink to sign up for my health insurance. DC HealthLink provides solid customer service, and the representatives I've worked with have been exceptionally helpful. When I needed a letter attesting to healthcare coverage for traveling overseas, I received the documentation much faster than I expected. The digital self-service on dchealthlink.com has been very easy to navigate, which is helpful to me because I have quite a full schedule and don't always have time to be on the phone to make changes to my plan. Having access to quality health insurance coverage is critical for me, especially during the COVID-19 pandemic. I was very concerned I could contract COVID-19, and if I was without quality coverage, I knew I could incur steep hospital and medical bills. Additionally, as someone who travels frequently because of my career, becoming infected with COVID is a real concern. With my coverage through DC HealthLink, I don't have to really worry about that if I get sick or need to see a doctor, I will face an overwhelming financial burden. Quality health insurance coverage through DC HealthLink gives me peace of mind, which is critical for me both personally and professionally. I'd also like to add that DC's speed of service and efficiency are quite commendable when it comes to engagement with public services. My only other previous experience with engaging with public services was when I had previously lived in Chicago, and the difference between them is night and day. I want to thank you very much for the opportunity to share my experience. I'd be happy to answer any questions you may have.
Thank you, Barbara. We appreciate your testimony. We appreciate you being here today, and we'll look forward to continuing to work with you. We appreciate the work that you're doing with the health exchange, health benefit exchange. It's an important part of our arsenal of healthcare services for people here in the District of Columbia, and it's very exciting to know that you've had such a positive experience, and we'll look forward to you continuing to work with Health Benefits Exchange. So thank you so much for your testimony. All right. Angela Franco, are you here today?
I am here. Good morning, Councilmember Gray, Councilmember Pinto, and members of the committee. It may take a little more than 3 minutes because I'm gonna read testimony on behalf of the DC Chamber, the Greater Washington Hispanic Chamber, and the Restaurant Association.
All right. Well, you know what you've been here so many times. You know what the rules of the game are. So we'll ask you to go ahead and give your testimony, okay?
Okay, thank you very much. Good morning, Chairman Gray and members of the committee. I'm Angela Franco, President and CEO of the DC Chamber of Commerce. I'm very pleased to be here today to represent the member companies of the Chamber and the vast array of individuals they employ. Thank you so much for the opportunity to testify. We are pleased to support the DC Health Benefit Exchange 2023 budget as proposed, and we ask that you and the members of the committee maintain the funding as you move through the council's budget process. Sustaining the Small Business Health Option Program SHOP is more important than ever to small businesses in the district. Throughout the year, the DC Chamber continued to partner with DC HealthLink through virtual interactions and web-based information sessions to the small business community. This includes promoting the health insurance enrollment campaign during open season, conducting presentations, and sending direct emails to DC Chamber members, informing them on the benefits of participating in DC HealthLink. We also hosted an informative webinar to attract and retain loyal employees, which included offering a benefit package with built-in health insurance and assistance to any small businesses interested in enrolling in health insurance through SHOP. Pandemic, we focused our efforts on helping DC HealthLink promote and provide awareness of the following programs. DC HealthLink Special Enrollment Program for uninsured employees of small businesses currently covered through DC HealthLink. The Small Business Premium Deferment Program for past installments at no-cost insurance coverage benefits associated with testing and treatment for COVID-19. DC HealthLink Gap Initiative. DC HealthLink at Work, which offered on-site individual and family health insurance enrollment opportunities to employees, and the American Rescue Plan. For DC residents, the American Rescue Plan reduced premiums for health insurance through DC HealthLink for as little as $2 per month for people who lost their jobs, and it also paid 100% of COBRA premiums for laid-off workers. For the Restaurant Association, the Restaurant Association has partnered with DC HealthLink Benefit Exchange and has been enrolled in SHOP since its start in 2014. Their partnership with HBX has been critical in keeping restaurants informed and aware of healthcare incentives related to COVID-19 pandemic response, including options for maintaining coverage for staff and options for staff who do not have employer-offered coverage. For the Greater Washington Hispanic Chamber of Commerce, some of the most recent GWHCC's outcomes are the virtual one-touch enrollment events hosted by Carlos Rosario International Public School. Due to the COVID-19 pandemic, DC HealthLink and the Chamber redesigned the in-person one-touch enrollment service into a virtual event that provides DC residents with an easy and compassionate online opportunity to enroll in quality, affordable health insurance, and DC residents qualified for Medicaid, Alliance, and Cover All. I know my time is up, so we look forward to continuing working with the DC Health Benefit Exchange Authority to improve and maintain an affordable health insurance program for the district's business and families. Thank you so much for the opportunity to testify, and I'm happy to answer any questions. I kept it at 3 minutes.
Thank you very much, Angela. You were right on time.
Thank you. Thank you all for the opportunity.
Absolutely. We appreciate, of course, your testimony. Can you tell me very quickly how many firms through the chamber are participating in the exchange at this point?
Here. I don't have an exact number in terms of members, but it is something that we continuously do, and we follow more with the numbers of the DC Health Benefit Exchange. We make sure that we always have more and more businesses enrolled.
Okay, well, fantastic. We'll ask Mila Kaufman if she can, give us an estimate of the people.
Yeah, we have over. Okay.
Yeah, we'll just ask her how many people through the chamber are participating through the exchange, okay?
I mean, through the DC Chamber, we have made over 200 referrals in the last year. And from those, I don't know exactly how many have been enrolled. But we keep a tracking list, and that's something that we both are committed in doing. We're keeping tracking lists of businesses that we refer. We do that, I mean, maybe that's from my banking days, but I always keep like leads, and that's a big deal for us, that we are really working into making sure that we identify businesses that need health insurance. So we're actually tracking, we have referred over to 200 leads. We work with brokers, with some brokers directly, and there's some that the exchange can enroll directly.
Well, we appreciate it very much, Angela. We appreciate the work of the chamber and all the work that's being done to support the Health Benefit Exchange. And we invite you to continue to do that, okay? And we look forward to continuing to work with you.
Thank you so much, Councilmember Gray. And it's always good seeing you.
You too. Thank you for being here, Angela. It's Crystal Williams. Crystal, are you here?
Yes.
Okay, we're ready for your testimony, Crystal. Go right ahead.
Excellent. Good morning. And I just want to start out to say that my business is actually a business that benefited and was a lead and now a part of DC Health Links through the work that Angela and her team did. So as she was speaking of that, I am actually one of the business owners that her team reached out to. So I would like to say, yes, I would like to say good morning, Chairman Gray and the members of the Committee on Health. My name is Crystal Williams, and I am co-owner and director of operations of Fiscal Restaurant, which is located in Ward 1. I am pleased to offer my testimony before you today regarding DC Health Link and the positive impact that it has had on my small business as well as my employees. Additionally, I want to briefly describe how the COVID-19 relief funding to repay past due health insurance premiums, which Mayor Bowser induced and the district council passed, that initiative has tremendously helped our restaurant. Fiscal is a minority and veteran-owned and operated restaurant in Shaw. We are family-owned and operated. My younger brother, Brandon, is the curator and the executive chef of Fiscal. And again, I serve as the director of operations. My brother and I are involved in the day-to-day operations, and our work hours average about 15 hours a day. We come from humble beginnings, and we have poured our heart and our soul into the holistic health mission of Fiscal. Fiscal specializes in fish burgers, fish cheesesteaks, as well as fish tacos. And we source our fish from the ocean. So it is sustainable as well as wild caught. It is purchased fresh daily, and we crafted ourselves into burgers, and we add no unnecessary ingredients because we are definitely concerned about the health of our customers. We go through great lengths to know the origins of the fish we serve and how it is caught. Additionally, we house make all of our condiments from organic produce and ingredients. Our belief is when you eat, let the food taste good and be good for your personal health as well as the environment. We have been DC HealthLink customers since 2019. Prior to that, we were one of the businesses that definitely wanted to provide healthcare for ourselves as well as our employees, but we were concerned about the cost with being able to do that. Through connecting with DC HealthLink, we now are offering our employees their choice of coverage through Care First, Blue Cross Blue Shield. This way, our employees are able to choose the plan that best fits their mental, medical, and wellness needs. As you can probably guess from our laser focus on health and the environment, providing our employees access to quality, affordable health insurance coverage is paramount to us as a restaurant and as a employee conscious employer, which is what we strive to be. It's also just good business because a business is only as viable, sustainable, and healthy as its employees are. As we continue to navigate the ongoing labor shortages brought on by the pandemic, we are in need of more employees in order to grow. Because we offer great benefits through DC HealthLink, we can now compete with larger businesses to find and retain high quality employees, which again is key for our business to survive. I'm sure that you know that the COVID-19 pandemic has been devastating for DC residents. Since we opened our doors, we highly relied on indoor dining, but when we had to close our doors because of the lockdowns, we ended up having to convert to takeout and third-party deliveries, and business did start to pick up, but at the same time, we were very cautious in how many people were in the restaurant, how many people we serviced at a particular time. And we were also very cautious when it came to reopening our doors because we did not need anyone to get sick. We benefited from the, like I mentioned, from the past due premium initiative. We were able to have paid off about $15,000, which gave us a peace of mind. I just can't even say how mentally draining and stressful that was, knowing that I had these unpaid premiums. So I thank you very much for the opportunity to share my experience, and I'm happy to answer any questions.
Thank you, Crystal. Thank you so much for your testimony and the support you've expressed today for the health benefit exchange. Can you tell me where your restaurant is located? Because I want to stop by there.
Yes, so we are at 637 Florida Avenue, Northwest, Ward 1 in Shaw. So kind of close to the corner of Florida and Georgia in Northwest, near the Howard Theater.
Well, I appreciate that. I know exactly where the Howard Theater is. I'm a native Washingtonian. I grew up in the city and went to the Howard Theater so many times. So thank you for the work that you do and the support for the health benefit exchange. So thank you so much for you and your family, your work with the restaurant. Okay, Fiscal. I appreciate it.
Thank
you so much, Crystal. We appreciate your testimony, okay?
Thank you.
Welcome. All right. Thank you all so much for your testimony. Actually exhausts our panel of public witnesses. So I'm going to move to Mila Kaufman. Mila, you're here, right?
Yes, thank you. I'm gonna go ahead and share my PowerPoint.
Okay. Some of our public witnesses may want to stay for your testimony. We would be, of course, welcome to do that. We look forward to it, and we look forward to your testimony, all right? Go right ahead, Millie.
All right, I am. Here we go. All right, and I am so sorry that it's going to appear quite small, but we have submitted a copy of this PowerPoint for the record, and so it will be available publicly. First of all, good morning, Chairman Gray, and I would just like to thank you for establishing us when you were mayor and for all of your support over the years. I also would like to say thank you for Councilmember Pinto's kind words and the challenge of getting to 100%. I think both you and the other council members and Chairman Gray are always establishing a very high mark for us to achieve to get to 100% coverage rate, and that is certainly our goal. And this morning with me, I have our Chief Financial Officer, Marjorie Edmonds, in case there are any questions you may have that she can assist in providing you answers with. Let me just do a quick background on us. As you know, we have a private executive board. We are a private public partnership, and our executive board chair, Diane Lewis, is here with us today as well. We were the last state to start building our IT system, and proudly, we were one of 4 state-based marketplaces that opened on time and stayed open on October 1st, 2013. And as you mentioned in your opening remarks, we cover about 100,000 people with private health insurance, and that includes 80,000 that are covered through our small business marketplace. And that includes more than 5,300 district employers. We also are the source of coverage for Congress, and we cover both members and their designated staff on the Hill and in their district offices. And we also proudly serve DC residents with individual health insurance coverage. We are responsible for over $620 million in annual premiums. And since we've opened, we've helped the district cut its uninsured rate in half. And so now more than 96% of DC residents have coverage. And DC ranks number 2 in the nation for the lowest uninsured rate. We have broad choices for employers, 157 actually, and 36 plans have lower premiums than in 2021. We also have 27 different options for residents, and 6 of those have lower premiums than in 2021. Every year, we advocate for the lowest possible premiums for all of our customers. And our choices include 3 different United Healthcare companies, 2 Aetna companies, Blue Cross Blue Shield, Care First, and Kaiser Permanente. We're very proud that we offer standard plans. So those don't have deductibles for primary care, for specialists, for mental and behavioral health, for urgent care, and generic prescription drugs. And our co-pays are very different than co-insurance, which makes it very easy to compare. And for 2022, insulin and diabetic supplies are covered at no cost to the patient. All of our plans cover diagnosis, testing, and treatment for COVID-19. And importantly, more residents qualify for lower monthly premiums because of the American Rescue Plan. And we have premiums as low as $11 a month for comprehensive quality health coverage. As you know, we quickly updated our website, and 2 weeks after the American Rescue Plan legislation was signed into law by President Biden, we launched all the new benefits on dchealthlink.com. The lower benefits are available through 2022. The lower premiums, that is, are available through 2022. And district residents save approximately $36 million per year in lower premiums because of the American Rescue Plan. And again, our premiums are as low as $11 a month. So if you're uninsured, it's not too late to get coverage now. Just go to dchealthlink.com and choose COVID-19 as your special enrollment period and get insured. Don't wait another day. And I just want to underscore, right now in Congress, there's a debate about whether to extend lower premiums beyond December 31st of this year. And the effects of not extending will be devastating, both nationally and here to our residents. We estimate that residents who are currently getting lower premiums will pay 48% more on average next year if lower premiums are not extended by Congress. And we also estimate that more than 1,600 DC residents may lose their individual marketplace health insurance because they will lose lower premiums if the American Rescue Plan is not extended. On the other hand, if it is extended, then nationally, more than 4 million people will become newly insured. 8.3 million people will get lower monthly premiums. That's in addition to those who are getting lower monthly premiums now. And nationwide premiums will decrease by 10% or so because the insured risk pool will become younger and healthier. I do want to focus a little bit on the very important program that Mayor Bowser established, and you helped support Councilmember Gray. In FY21, Mayor Bowser established a $15 million emergency COVID relief fund through us, through HBX, to help district employers and residents stay insured. Now, this paid for DC HealthLink health insurance premiums that were in arrears, that were overdue. And you heard from one of our employer customers earlier this morning from Crystal Williams, how her business was directly helped from this relief. Now, last fiscal year, you, Councilmember Gray, prioritized this funding in the supplemental FY21 budget, and the entire council approved it. So thank you very much for that relief. Also, as part of that, we were able to partner with our health plans who agreed to write off an additional estimated $1.4 million for DC HealthLink customers who were in arrears but did not qualify for the COVID relief arrears program. The impact has been very significant, with approximately 500 district employers covering 5,000 people with small group coverage, and about 1,800 residents with individual health insurance were able to stay insured during the pandemic and have a fresh start with premiums. And I'm so thrilled that Mayor Bowser included an additional $3.75 million in the FY 2022 revised budget to continue to help employers with economic recovery. And if council approves, this will total nearly $19 million for FY21 and 22, providing relief, keeping employers and their workers insured during this ongoing pandemic, and helping district employers to recover from COVID's devastating economic impact. Now, I want to turn your attention to our proposed FY 2023 budget that funds the Health Benefit Exchange Authority. In developing our budget, we used our regular process, which included getting input from stakeholders through our Standing Advisory Board and approval of this proposed budget by our Health Benefit Exchange Executive Board. We continue to leverage the services that are provided by other DC government agencies. We continue to phase out our reliance on consultants, transitioning more to FTEs, and we continue to reduce our operational costs through the partnership we have with the Massachusetts Health Connector. In that partnership, we estimate a savings for FY23 of about $1.3 million. Our proposed budget for FY23 is approximately $35.6 million, and for assessment purposes, it's $34.3 million. The budget increase for FY23 pretty much reflects the increase in our costs to operate the DC HealthLink call center, because we're no longer cost allocating that service with Medicaid. And as a reminder, we are mostly funded through an assessment on health carriers, and we estimate the assessment to be at 0.9%. And just to recollect your memory, we started with a 1% assessment, and then we were able to decrease that assessment to 0.9%. Last fiscal year, we further decreased the assessment to 0.825%. And this coming up fiscal year, we estimate needing 0.9%. And for us, it's actually really great news. We were worried that with increased costs for the contact center, we would need to increase the assessment much more. But the good news is that we're back to normal at 0.9% assessment. And just a quick comparison between FY22 and 23, the largest increase in our proposed budget is Marketplace Innovation Policy and Operations. That is where our contact center budget is. As you can see, there are also some increases for consumer education and outreach, IT support for DCHealthLink.com, and slight increase for agency management program and the agency financial operations. I just want to walk you through how we get to the assessment budget being lower than our proposed budget. So our proposed budget is approximately $35.6 million. We receive reimbursement from the Massachusetts Health Connector for 6 FTEs. We also earn administrative fees on that partnership. In addition, the Massachusetts Health Connector pays for some of the contact center costs, as well as they reimburse us for mailing and postage fees. And we anticipate having about $100,000 in our investments and interest earnings. And when you net out all of those costs, we get to $34.3 million, approximately our proposed budget for assessment purposes. I'm just going to skip very fast through some of these slides, and just to point out that marketplace, innovation, policy, and operations is our biggest division, and next to that is our IT. So I want to focus your attention on some of our costs that are not personnel related. So I'm going to jump right into our contact center costs. There's an increase from last year from 3.3 million to 4.2 million proposed for FY23. That includes our contact center service contract at 3.8 million, licenses that we have, and development costs, as well as small admin cost and the cost of the language line. Our eligibility and enrollment, we were able to find some cost savings compared to FY22. So there are no surprises. We continue to have a small fee for the MOA that we have with Office of Administrative Hearings for our eligibility appeals. We have ongoing costs for notices and printing, and those are all required federal notices. We are budgeting $27,000 for translations of notices, and we have a consulting budget of $250,000. Our plan management, we were also able to achieve a slight budget reduction. Our actuarial services remain the same as last year, and our plan match tool, which is anonymous shopping, which is an award-winning tool. We've been ranked #1 for consumer decision support tools nationally for 2 years in a row. And that's our plan match tool, which provides not only a doctor directory, but also an online prescription drug formulary lookup tool. You can input up to 10 medications and see how each health plan covers that medication or the set of medications. We also have dental plan match if you're looking for just dental coverage, which we have, which we offer. You don't have to sign up for health insurance. You can just get dental through us, and we have many residents who do just purchase dental coverage. That anonymous shopping tool can help you choose among dental plans. Our budget for our small business marketplace is just slightly higher than last year, with required services like premium aggregation, which is the funding that we collect from employers for premiums and then send them out to health insurance companies, and costs for mailing and postage for required federal notices and translation services. There's a small increase for performance management, part of MIPO, which includes computer refresh, supplies, training by the National Association of Health Underwriters for our brokers, and some other software tools. Our consumer education and outreach budget is slightly higher, and for the non-personnel services, it includes $1 million, which is what we budgeted for the last many years, actually, to fund our assisters, DC Health Link assisters, as well as the partnerships that we have with the largest 3 chambers, the DC Chamber of Commerce, the Greater Washington Hispanic Chamber of Commerce, and the Restaurant Association, Metropolitan Washington. So that budget remains the same as at $1 million. Our outreach and marketing is slightly over $1 million. Our health insurance literacy campaign is $90,000, and some other administrative and data sources that we pay for. Our IT is slightly higher than last year, and most of it is driven by increased costs for software as well as IT consultants. The non-personnel budget is close to 7.1 million. Compared to 6.6 million last year. And as I mentioned, it's driven by higher costs for our software mostly and consultants. Our agency management program is relatively the same as last year. And the non-personnel services includes fixed costs like rent and telephone, and a bunch of MOAs that we have for services with other city agencies that can help provide those services in a very efficient way for us. And finally, our agency financial operations budget is very close to what it was last year as well, with non-personnel, including auditing services, required audits that we pay for, as well as small amounts built in for training and administrative fees. Just to wrap things up, we have been recognized by many, including receiving in 2019 a Sustainability and Equity Award from Amazon Web Services International Competition. We've received AWS awards for best practices in innovation in 2016 and 2018. We've won PR News awards, and we continue to have the first and still the only in the nation state-based marketplace partnership with the Massachusetts Health Connector. And their board recently approved another 5-year MOA with us. So we're thrilled that 5 years was very successful, the first 5 years, and we look forward to our partnership for another 5 years with them, renewed every year. And with that, Mr. Chair, I conclude my formal testimony and look forward to receiving your questions.
Thank you very much, Mila. You mentioned MOAs. Can you describe with more detail what those MOAs are in which the exchange is involved at this point?
Yes, we have a number of MOAs with a variety of city agencies, including with GCHR. They provide us with human resources services. We have an MOA with DISB. They do our annual assessment of health carriers every year. We have an MOA with Office of Hearings and Appeals. They get eligibility appeals if someone is either denied eligibility or believe that they are that they qualify for higher APTC, for example. Those appeals go to a formal administrative process. So those are just some of the MOAs that we have.
Thank you. I appreciate the fact that you share that information with us, Mila. And by the way, I want to underscore, you know, how exciting this has been over the last several years. I'm delighted to have been a part of the creation of the Health Benefit Exchange and the leadership that you have provided, along with Ms. Lewis, getting us to where we are. You've mentioned we're second in the nation. Is that right?
That's
I'm so competitive, thinking of March Madness now too. But what do we have to do to get to number one, if that's possible in this environment? So can you share that?
Sure. So more than 96% of the insured population, that's near universal coverage, but it's not 100%.
Mm-hmm.
For folks who remain uninsured, tend to cite affordability as the number one reason. for continuing to be uninsured. And so what we need to do even in a more robust way, and I think our outreach is really second to none, and we do an excellent job using community voices and trusted voices to find uninsured people. But we have to continue to double down on that and use trusted voices, whether it's our assisters or other community partners or the chambers. You were talking with Angela Franco, the CEO of the DC Chamber, about their efforts. Well, not only do they help us with the small business community, but they also help find self-employed people who may be chamber members who don't have employees but are self-employed or members of the chamber, and help us get those folks signed up on the individual side. So that's really the key. And also anything that we can do to make coverage more affordable. And I mentioned the biggest affordability boost has been from the American Rescue Plan. People who qualify for lower premiums saw their premiums drop dramatically. As I mentioned, as low as $11 a month. And that makes coverage, comprehensive coverage, very affordable.
That's very important information for us to have, Mila. I appreciate it very much. Can you explain? You talked about, your budget talks about the social justice work that you're involved in. Can you speak to what the board's recommendations are with respect that will allow us to address health disparities and what is the key to the success that you are engaged in on the social justice work?
Good morning, Councilmember Gray. This is Diane Lewis, Chair of the Board. So good to see you as always. I'll respond to that question. We have worked, as you know, we established a working group adopted by the board to move forward with looking very carefully at social justice issues and health equity. Our year one recommendations looked at plan design and algorithms. With regard to plan design, we looked at diseases that disproportionately impacted communities of color and made those our initial focus. Plan design always sounds so esoteric. In this instance, we focused on diabetes. As many of us know, it certainly disproportionately impacts communities of color. And if you're one of those patients who has to make the decision between rent, buying food and other necessities, and paying for the coverage of your care, plan design becomes very real as an issue that impacts your life. And if you are at risk of amputations or the loss of sight, again, this is very significant. So our plan design focuses on diabetes, and in 2023 will be at no cost. So it'll cover physician visits, blood tests, vision and foot exams, prescription medications and supplies with no cost sharing, no deductibles, no co-payments, and no co-insurance. And we are particularly excited about moving in this direction. In addition, for the first time, our standard plans will also be in the small business marketplace. And the second focus of the recommendations for year one is algorithms. And algorithms are not unique to healthcare. We see them in employment, we see them in housing and lending, just to name a few. But obviously our focus is healthcare, where recent studies have shown racial bias in healthcare algorithms. In this instance, we looked at a number of areas, and the consensus came arrived at was with regard to testing for kidney disease. And the GFR, which is a tool for determining kidney function, was the focus of the group's decision and recommendation that as a result of the findings that there was bias in that tool, that over the next year, our carriers would no longer permit that use. Following the National Kidney Foundation's guidelines, race estimating for the GFR will no longer be accepted in our networks. And that's incredibly important and makes the difference for people who are suffering and managing kidney disease and for those who may need transplants. So this is an important decision. And as you say, and as you talked about basketball, in basketball speak, we really got an important assist from the National Kidney Foundation with regard to these algorithms. And they made the difference in supporting the decision that our carriers made and are carrying out to prohibit racially biased algorithms. But we also recognize that the challenge going forward as we deal with algorithms is to make sure that we broaden our conversation so that others are committed to that as well. I just one thing to say about our success, and I think what's incredibly important, and Mila talked about it too, is the involvement of our stakeholders. We have many. We have our carriers and our providers and our brokers and a host of other folks who have worked with us over the years to make the difference in how we address any number of issues and concerns and develop solutions. And they've brought their best ideas and their strategies to the table. They've made the difference in how we've developed solutions that work for everyone. And so we are particularly proud of those relationships. We continue to have them, and they will continue to move us forward with regard to our health justice work.
Ms. Lewis.
Yes.
Work that the exchange is doing on the social justice front. I appreciated the fact that you all were at the groundbreaking for our new hospital that's being, it's not just a new hospital, it's a healthcare system that's being created. It just has not existed heretofore on the east end of the District of Columbia. And it's going to take a couple of years for us to finish, complete building the new hospital and new network of services that we're engaged in. But we, like you all, are very excited about the opportunities. I know that health benefit exchange will be key to us being able to make sure that people have the health care coverage that they deserve, that they need, and to be able to use the additional services that we're creating on the east end of the city. So I just want to thank you all for that work and just express my appreciation and hope that you all will continue to work with us to be able to get this health care system that will involve not just a hospital, but it will involve a variety of other services as well.
Absolutely. Absolutely.
Thank you so much for the work that you all have done to be able to get us to that point. So I appreciate it very much. So, Councilmember Henderson, are you here?
I am. Yes, sir. How are you doing, Mr. Chairman? Good morning.
I'm doing fine. How are you? I want to give you an opportunity for a round of questions.
Okay, great.
For the folks with the health benefit exchange, okay?
Thank you. Thank you. Good morning, Director Kaufman. Good to see you. Good to see you, Ms. Lewis, as well. I wanted to, Director Kaufman, I wanted to ask you about something from your presentation from earlier. So one of the things I think that people haven't necessarily fully started to grasp yet is like what to expect once some of the federal programs that were put in place during the pandemic start to expire. And I think you said in one of your earlier slides that more than 1,600 DC residents will lose their individual marketplace health insurance perhaps at the end of December if Congress doesn't extend. Does this budget do anything for us on the local side to be able to support these individuals should that happen?
Well, one, we hope that Congress extends the lower premiums because millions across the nation will lose affordable coverage. Here, what we'll be doing is looking at income levels of those folks who may not qualify for any lower premiums or who may not qualify for as much in lower premiums, and seeing if they qualify for Medicaid. DC's Medicaid eligibility is, I would say, the best in the nation.
Yeah.
Thanks to the many years of improving the Medicaid program that you and other council members have engaged in. So it's really second to none. We think when people lose their private coverage, many could qualify for DC's Medicaid coverage. So we'll be looking at that as an option.
Okay. Okay.
Oh, one other thing I forgot to mention. So when the American Rescue Plan lowered premiums for people, we saw a number of our enrollees switch from silver plans to gold plans.
Oh.
People bought up, meaning they chose to pay higher premiums for gold, but get lower deductibles because gold has lower deductibles.
Right.
So another thing we'll be looking at is for people, assuming worst case scenario, American Rescue Plan lower premiums don't get extended, we'll be looking to see if those residents want to switch back to silver or switch down to bronze with higher deductibles, but they'll have lower premiums to help keep people insured. The other, finally, I just want to say, because of our standard plan design, most of our residents can get care they need without a deductible. So our standard plans cover as many doctors, primary care visits as you need, as many specialists as you need, including mental health, behavioral health, substance abuse providers.
Yeah.
Without deductibles. So the impact of the higher deductible isn't going to be as significant as if you lived in a different state without this kind of standard plan design.
Right. So actually, let me ask you about that in terms of a robust standard plan, but on the customer call center side, are we hearing from people who are saying, I still can't find a provider though, right? Like I have the coverage, I have insurance, but I'm still having a difficulty finding a provider for the services I'm looking for.
We're not hearing those kinds of complaints. They may actually be going, if there are
they would be going straight to the companies.
Exactly.
Okay.
And on our website, we do have provider directories, which are current for all of the health plans we offer. Plus, I think all of our health plan products offer access to telehealth. And so if you're not able to get in the office in person, or the provider is too far from you, further than you'd like, there are telehealth options available as well, which include video visits as well as email and phone visits as well.
Okay. I want to ask you a question that's on topic, but kind of off topic as it pertains to money, with, in terms of your agency budget. I'm curious if you know of any of the plans that are currently offered on the exchange that provide coverage for infertility treatment already.
I'd have to get back to you on that.
Okay.
I don't think it's part of our essential health benefits benchmark, but I will check that and follow up with you in the committee.
Okay. I'm just very interested in terms of where we go from there. In terms of the costs around your call center contract, you still contract out.
Correct.
And I'm imagining you all have some type of service level agreement around how many calls, how long the wait time should be. Are they meeting the metrics to which you are asking for, I would assume?
Well, thank you for asking. No.
Oh, okay.
Call center is something that is a service provided by vendor. And actually we're going through an RFP process now.
Okay.
And once we select the vendor, that contract will be requesting the council to approve the new contract with option years, but that's still in the process. In terms of our current vendor, for most years that we've been with this vendor, the vendor did meet our service level agreement and standards. This past year, it has been very rocky. Some days, the wait times at our call center were just unacceptable, much higher than we expected. During open enrollment, the wait times exceeded what our standards were for at least one of the months. And so the penalty that is available to us under that contract is financial, which we triggered.
Okay. So, I mean, I guess I'm assuming at this point, you still find it to be more financially fruitful and beneficial for it to be contracted out versus an in-house operation.
Yes, we've periodically looked at costs contracting out the contact center versus hiring our own staff and supporting that kind of effort. And every time that we've run the comparisons, it's been more cost effective to continue to contract that service out. Okay. And so the current vendor uses CBEs as subs. All of the staffing, in fact, is provided by the local CBEs.
Okay. Okay. I mean, it's just a question that I had around, I have to imagine that there are staffing challenges that the call center is facing, the same type of staffing challenges that we're having everywhere else. And so I was just curious in terms of, what happens there, on that front. In terms of the FTEs that you have at the exchange, how many vacancies are you currently carrying?
Too many.
Oh, okay.
Yeah, and if I can just go back to the contact center point you made, yes, recruitment and retention is very difficult everywhere. It's especially difficult for contact centers.
Yeah.
And it's been every year it's been difficult because when you have frontline people who answer calls, yeah, it could get very emotional and sometimes there's just burnout.
Yeah, I totally understand.
And so there's always more turnover in contact centers every year. But now with the labor market being the way it is, it has been difficult all around. Now we have moved our contact center to be 100% virtual. That meaning people don't have to travel to a location to take the calls. They can work from home. That has made it better because then people can work the hours they want. They don't have to spend time traveling. It just makes it easier for people to work from home.
Okay, but what about
us?
Yes, your people.
Yes, for us, we've engaged in a number of different efforts for retention. Like for instance, when we saw the gas price per gallon, go sky high at close to $5 a gallon, we implemented immediate flexibility relief policy for folks who have to come into the office 3 days a week. We're allowing an extra 2 days a week of teleworking. So people can come in 1 day a week. And that's helping. Immediately when we implemented that policy, we heard from a number of our staff members saying now they don't have to look for another job because they can telework more. We've done other things. We're piloting a permanent telework policy. And it covers about 40 of our staff members, and it's just a pilot that our board authorized for 1 year. And how it works is you have to live in this area to be eligible, and we used a lottery essentially. People who wanted to telework 5 days a week, they put in, and then we chose randomly folks. And so we're testing out to see how productive, how efficient people stay, and whether or not that could help us with retention.
Okay.
And we have a CBE that we retained to actually track that for us. So they're going to be serving employees who are part of the pilot and who are not, to see if that helps with retention, with job satisfaction, if it's important for people to have that option. So we're piloting that. In about a year. We'll know what the data shows around that. But we've had vacancies for certain positions. We've had to repost multiple times. We've given offers, and people essentially used our offers to get a better offer somewhere else. So it's been quite a challenge.
Okay.
To recruit, and we've lost some folks to other opportunities where there's more flexible telework, or just we can't compete with the salaries.
Okay. All right. Well, if we can help in any way, sort of elevate the conversation around whatever openings you have, please let us know. I'm over my time. Thank you, Chairman Gray. Thank you, Director Kaufman.
Thank you so much.
Thank you very much, Councilmember Henderson. If there are additional questions that you have, let us know. We've had a close working relationship with the Health Benefit Exchange and a free flow of information and questions that we'll be happy to follow up with you on your behalf. So please let us know if there are questions that you have that you want additional answers to. So appreciate it. Thank you. And I want to thank you, Mila, and you and Ms. Lewis also for the continuing work you all do. Again, the work that we're doing, try to expand healthcare services on the east end of the city. Again, I appreciate you being at the groundbreaking for the new hospital, the new healthcare system, I should say, on the east end of the city. And we'll look forward to working with both of you, with you and with the board as you continue your work, especially to continue to reduce the numbers of people who don't have healthcare insurance coverage in the District of Columbia. So thank you, thank both of you, you and Ms. Lewis both, for the services that you provide, and we'll look forward to continuing to work with you. Okay.
Thank you.
Thank you so much for all your support.
Sure. Thank you very much. Thank you all very much for being here, for your testimony today, and for answering the questions that we have, both for myself and for the members of the committee, who were here. So thank you all very much.
Thank you.
We're going to take a brief break here. We're going to have the Department of Behavioral Health to come up very shortly with Dr. Bazaron. So let's take a brief break here, and we'll come back very shortly for her testimony. Excuse me, public testimony that precedes that. Okay. And let me get my list of people who are here to be a part of that.
Uh, uh, Mr. Chair, how long should we have our break?
Will that work?
I'm sorry, sir, you were muted.
Pardon?
You were muted. Could you say that again?
7 minutes.
Thank you.
All right, guys, we're going to resume our hearing now with the Department of Behavioral Health. We may have members joining us as we go along, which I doubt that they will. And in the meantime, let me, get ready, get us ready for the public witnesses that are going to testify. Okay. Let's start with. All right, let's begin with our public witnesses. I want to thank you all for coming today and being a part of this, and we'll look forward to your testimony. Let's begin with panel 3, starting with Sarah Hoffman. Sarah, are you here?
Chairman Gray,
You are?
I'm here.
Okay, great. All right, we're going to begin with you, Sarah, and then Amber Reiki. Amber, are you here?
Yeah.
Great, okay. And I think Hannah Garlick, are you here?
Yes, sir, I'm here.
Okay, Mark Lavoda, are you here, Mark?
Yes, good morning.
Great, okay. We're going to begin with Sarah Hoffman. Okay, Sarah, go right ahead with your testimony.
Thank you so much. Good morning, Chairman Gray and members of the committee. My name is Sarah Barclay Hoffman, and I serve as a program manager with the Community Mental Health Core at Children's National Hospital and Director of Policy for the Early Childhood Innovation Network. We are also members of the Strengthening Families Through Behavioral Health and Under 3 DC coalitions. Thank you for the opportunity to testify today. My work affords me the privilege to hear from those who are on the front lines of caring for the emotional well-being of our city's children, families, behavioral health clinicians, pediatricians, family-run organizations, child care providers, and others. These voices, while from across the wards and in differing sectors, are nonetheless aligned, urgent, and unwavering in their strain. Our beautiful and precious children in the district are suffering. Anecdotally, our clinicians at Children's National speak of grim and gut-wrenching patient scenarios, such as increases in behavioral health inpatient and outpatient acuity levels, the likes of which some of these professionals state they have not seen during the entirety of their careers. And yet, this chorus of voices is resolute in the belief that with smart, adequate, and consistent investments in an integrated, place-based behavioral health ecosystem, we can move from crisis to flourishing. We thank Mayor Bowser, the Council, and DBH for investments in behavioral health and urge specific investments for FY23 in the following 3 areas. Healthy Futures. This is an early childhood mental health consultation program which promotes positive social and emotional development in young children in childcare settings. It has shown high quality outcomes, has continued successful expansion during the pandemic, and is a trusted program in the community. We should build upon what is working. We urge the council to enhance funding for Healthy Futures by $700,000 so more infants and toddlers will have access to critical preventive and early intervention mental health services, and so that we can reach more subsidy participating child development programs as indicated in the Birth to 3 law. School-based behavioral health. We commend the district for building out this vital service. While Children's National is not a provider in DBH's school-based behavioral health program, we recognize the costs inherent in attracting and retaining a high-quality workforce and how adequate financing is key to ensuring a stable behavioral health care program. Our clinicians speak consistently and often about the positive difference school-based behavioral health services make for their patients. Therefore, we encourage the council to continue to invest in school-based behavioral health services to ensure that the FY23 budget supports a clinician in every school and at a community-based organization grant level that bolsters consistency and longevity of the program, which requires council restoring these CBO grant levels to $80,000. We also support a cost study to right-size the grant amounts for participating CBOs, which requires the appropriation of one-time local dollars of $300,000 for the study. Lastly, rates for community behavioral health services. Community-based DBH certified providers are operating in a system with Medicaid reimbursement rates that were calculated using data from 2016 and have never been adjusted for inflation. We urge the council to increase funding for community behavioral health services. This includes ensuring providers are adequately compensated for all of their services. These services are vital for our patients and prevents them from going into crisis. We look forward to continuing to collaborate with DBH in the coming fiscal year. Thank you again for the opportunity to testify, and I'm happy to answer any questions you may have.
Thank you very much, Sarah, for your testimony. And I know you're aware, you're with the Under 3 Coalition, is that right?
We are members, yes.
Good, okay. Well, you know, we worked very hard to be able to get additional money for the Under 3 program. And as I'm sure you know, the legislation to create the Under 3 program I actually did the legislation, and I'm delighted for that. And I'm delighted that we've got some additional money that will be available for, for services to the Under 3 population. So thank you for your testimony today. We appreciate it.
Thank you, and thank you for your leadership, Chairman Gray.
Okay. Amber, are you here?
I am. Good morning.
Morning. How are you, Amber?
I'm doing well. How are you?
Go right ahead with your testimony.
Thank you. Good morning. My name is Amber Reiki. I'm the Director of External Affairs for the DC Health Matters Collaborative. Thank you for the opportunity to testify today about the fiscal year 23 budget. The DC Health Matters Collaborative is a partnership of hospitals and health centers that work together to achieve a healthy and thriving capital city. We've been focusing since 2016 on the shortage of behavioral health services and workforce in DC because the community has been telling us to do so, but also because everything else we work on keeps bringing us back to this issue. We simply cannot achieve equitable well-being unless we retain and expand our behavioral health workforce. Now, it's common knowledge that DC's residents are suffering from an ongoing behavioral health crisis, yet about 60% of adults and youth with mental illness are not receiving treatment. DC Health Matters Collaborative is also part of the Strengthening Families Through Behavioral Health Coalition you're already hearing from some of my colleagues today. We are grateful for the continued investments in the school-based behavioral health expansion program. The proposed budget includes essential resources, but the full cost of operating the program and expanding to every school in DC requires permanent stabilized funding based on today's costs for the grants to community-based organizations. Therefore, we ask for $2.4 million more in recurring local dollars to ensure that CBO grants fund $80,000 per clinician rather than $70,000. The council has added one-time dollars to do this for 2 years. Pay is one reason we are still struggling to staff all schools. The mayor's budget includes funding for 50 new clinicians, but these positions will still be difficult to fill if we aren't paying enough at baseline. We also ask for $300,000 to conduct a comprehensive cost study to determine how student, provider, and community needs impact costs and identify a sustainable funding model. And outside of school walls, but linked, current community-based behavioral health services need an additional $10.3 million in recurring local dollars. Current rates are based on 2016 cost data, are not financially sustainable, and not adjusted for inflation. And lastly, we strongly recommend that this committee engage with the Committee on Labor to hold a joint hearing about the behavioral health workforce. Budget season happens to coincide with spring gardening and cherry blossom time in DC, so I hope you'll indulge a metaphor for the school-based behavioral health program that has occurred to me. With this program, the district has planted a garden. It will produce beautiful blooms and nourish many with what it grows. But when we started our seeds, we didn't know of a storm ahead that would throw off the weather and every plant's health for 2 years. This is the pandemic in this metaphor, to be clear. The weather seems better now, but we see how many plants were bent or are struggling toward the sun. Now we are dedicated gardeners, but we need more resources, more tools to achieve the potential that we imagined. This is how we might think about each school and the amazing behavioral health teams. They are hardy and vigorous, but we need to enrich our soil, give them the best light and conditions to thrive, and keep coming back year after year. To keep straining this metaphor, I'm going to come back to the request for a cost study. We need to get a little scientific with our garden as we've watched our conditions change. Soil composition is a very complicated balance of nutrients, and different plants need different conditions. Even if you get that balance perfect in the spring, it can be completely depleted at the end of a growing season. Sunflowers, for example, take a lot of nitrogen for the soil. Imagine 6 years of sunflowers in the same soil. Are they still growing? We should probably conduct a soil test, and don't be surprised when you need a few truckloads of resources to create optimum conditions. Now, I know that's a little cute for something that's quite serious. I've talked to providers and I've heard stories that break my heart and keep me up at night. But I also have hope in the vision that we've set out, and we must give this all the resources next year and the next. So to conclude, we celebrate the district's investments in behavioral health services. And as we work to develop our programs, we must be attentive to workforce capacity and ensure adequate funding to achieve equity and well-being in DC. Thank you for the opportunity to testify today.
Thank you, Amber. You've been consistent in being in testifying at our hearings, and we appreciate that. And we appreciate your testimony today. Let me just remind the additional witnesses too that our limitations are pronounced in terms of the time that we have for our witnesses today. So we'll just ask you to follow the rules that have been laid out. So Amber, thank you so much again for your testimony and for that of your colleagues. Okay.
Thank you so much.
You're welcome. Hannah Gorelick. Maybe I mispronounced that name. Did I mispronounce that?
That's okay. You got it. Thank you. Good morning. Thank you, Councilmember Gray and members of the committee. My name is Hannah Gerlich, and I'm a community organizer with Jews United for Justice, a local grassroots organization that mobilizes thousands of Jews and allies in DC to fight for social, racial, and economic justice. Thank you, Councilmember Gray, for your continued work championing the Birth to 3 law. You're disappointed to see that the mayor did not include any funding increases to Healthy Futures program or any of the Birth to 3 family health support programs this year. As a member of the Under 3 DC Coalition, JUFJ asked that the DC Council allocate at least $700,000 to expand Healthy Futures, which provides child-focused behavioral health supports to educators in childcare settings. This increased funding can strengthen the program's infrastructure, including hiring additional staff, addressing staffing needs, and providing professional training. Jewish tradition teaches us the value for the Holy One heard the voice of the child who was there. Our tradition tells us that just as the Holy One listened to each of us, so too should we listen to the experiences of those who are experts in their own lives, of the children, parents, and educators. Those who are involved in the growth and development of young children should have the resources and training to listen and to support the voices of young children. Effective social emotional skills and supporting mental health challenges are key to a child's healthy development. These skills play a vital role in helping children make friends, learn new skills, and succeed in school in the early childhood years and beyond. Healthy Futures has had success doing all of this. The program provides an evidence-based early childhood mental health consultation program that promotes positive social and emotional development in young children. Increased funding for the Healthy Futures program by at least $700,000 will enable the Department of Behavioral Health to make much needed updates to the program's infrastructure, hire personnel, and increase the program's capacity to expand by 25 to 35 additional child development facilities next fiscal year. These steps will significantly advance efforts to reach all subsidy participating child care development programs in the district. These funds could be used to hire 3 to 5 new consultants and more supervisors, with additional funds to cover overhead costs associated with additional professionals and implementation of the program. And reports and data collected by providers in the district, teachers participating in Healthy Futures reported improvements in classroom management and more positive interaction with children and parents. Improved relationships contribute to more positive and collaborative learning environments for students, staff, and families. And reports showed improvements in educators' ability to manage challenging student behavior, their knowledge of how to refer children and families to mental health services, and their comfort with mental health services. Now more than ever, we know that mental health services are vital to the strength of families and communities. As members of the Under 3 DC Coalition, we've seen great strides in funding for Birth to 3 law. JFJ enthusiastically supported taxing high-income residents last year, and we're grateful to see this increased revenue being used to support the higher compensation of early childhood educators. Greater investments in family health support programs like Healthy Futures also help children and families in the district continue to grow and thrive. We hope you rectify the lack of funding from the mayor's budget proposal and ensure the final fiscal year 23 DC budget includes at least $700,000 to expand Healthy Futures. Thank you for the opportunity to testify today.
Thank you very much, Hannah, for your testimony and for the continuing work of you and your colleagues. As I'm sure you know, I've been a champion. I mean, I was one of the architect of the legislation for Under 3. And we'll continue to try to do as much as we possibly can to make sure that the dollars that we've generated are being directed now to improving the wages of those who do this work. That's an important thing to do. And I'm excited about that. So thank you, Hannah, for your work, okay?
Thank you, Councilmember Gray.
Mark Lavoda, are you here?
I am. Good to see you today.
Good to see you. And before you testify, I think we've been joined by Councilmember Lewis George. Also, are you there, Councilmember? Go right ahead, Mark. If she joins us, we will make sure she gets a chance for an opening statement once she does that. So you're on.
Great, thank you. Chairman Gray and members of the council, thank you for the opportunity to testify today. My name is Mark Lavoda. I'm the Executive Director of the District of Columbia Behavioral Health Association and a Ward 2 homeowner. The District of Columbia Behavioral Health Association works to advance high-quality whole person care for all district residents with mental illness or substance use disorders, including the 35,000 district residents that our 32-member organizations serve annually. We encourage council members today to review the mayor's proposed FY23 Department of Behavioral Health budget to clarify whether additional funding is needed to catch up payment rates to move forward the district's behavioral health system. The proposed DBH FY23 budget does not clarify whether there are sufficient funds to provide DBH certified provider organizations with an inflationary rate adjustment while waiting for results from a cost study that's underway. A temporary 20% rate increase is in effect for substance use disorder non-residential providers that serve about 2,500 of DBH's 35,000 consumers. Otherwise, providers working to support the other 32,500 DBH enrolled consumers are operating with rates based on 2016 costs. The Department of Healthcare Finance has requested a 1.8% inflationary cost adjustment from CMS for DBH certified providers, but there's a 16.1% gap from CMS's Medicare Economic Index for the period since 2016 when rates were set. The council should ask DBH whether anything in the mayor's FY23 proposed budget is expected to be used to catch up provider rates for inflation since 2016. If there's not, the council should fund the gap. Mental health community residential facility housing operators also face pressure from high inflation. The Bureau of Labor Statistics reports consumer price index change of 15.5% from December 2016 to December 2021. BLS doesn't provide a forecast, so the council should note that costs have continued to rise since December of 2021 and can be continued to be expected to do so through FY23. The council should ask DBH whether anything in the mayor's FY23 proposed budget can be used to adjust CRF housing operator rates for inflation since costs were last evaluated, and if not, the council should fill the gap. Initial review of DBH's proposed FY23 budget also does not clarify whether there are funds to stabilize school behavioral health expansion grants at the $80,000 per clinician level funded in the past 2 years through a combination of recurring and one-time funds. The mayor's presentation last week highlighted $3.8 million in new school behavioral health spending. This appears to include millions of dollars in new expenses for program infrastructure, wraparound services, and workforce pipeline initiatives. These are laudable, and we join the Strengthening Families Coalition in asking for grant amounts to remain stable with FY22 levels at $80,000 per clinician by replacing one-time funds with recurring funding, and asking for $300,000 to be spent on a cost study to right-size grant amounts to reflect a more accurate understanding of clinician costs, supervision costs, overhead costs, and reasonable expectations for successful use of blended grant funding, along with funding through billing for Tier 3 services. The council should ask DBH whether the mayor's FY23 proposed budget stabilizes CBO grants at $80,000 per clinician. If DBH believes a different number of clinicians or a different number of schools will participate in the expansion in FY23, the council should continue to ask whether the funding available will support grants of $80,000 per clinician for however many clinicians DBH thinks will be in the program. And if that funding is not available, the council should fill the gap. The budget does make clear that DBH has renewed funding for the expanded 911 diversion, community response team, access helpline, intensive care coordination for challenging cases, and healthy futures. We praise these decisions and encourage the council to seek assurances early that these items funded in the FY23 budget as district recovery plan services are expected to be permanent components of the district's commitment to ensure that DBH will continue to be able to meet the needs of people served through these services, and not only so long as federal funds are available. Thank you for the opportunity to testify today. Look forward to answering any questions you might have.
Thank you very much, Mark. We appreciate your work and that of your colleagues as well. And we'll look forward to hearing from you. You've been consistent in terms of your testifying here. And we've tried, as you know, we've tried to be responsive as much as we can to those needs as they have materialized over the years. And we'll continue to do that, Mark. So thank you very much for your testimony.
Thank you, Mr. Chairman.
The Councilmember Lewis George, I think she was here briefly. I want to make sure if she's back that we give her a chance for an opening statement and any questions that she may have. So Councilmember, are you here?
She's in the lobby, but maybe she's still muted.
Okay. Well, when she returns, because I'm sure she'll return, we'll look forward to hearing her statement and her questions at that point. So let's move next to the next panel. Got Billa, are you with us?
Yes, I am, Mr. Chairman.
But I think I came close to getting the name right this time. I messed it up enough.
It's Corbila.
Okay, we got that's helpful. Thank you so much. I appreciate it. So go right ahead with your testimony.
All right. Chairperson Gray and members of the committee, thank you for the opportunity to testify. My name is Corbila Huddleston, and I'm a policy analyst at the DC Fiscal Policy Institute. DCFPI is a nonprofit organization that shapes racially just tax, budget, and policy decisions by centering Black and Brown communities in our research and analysis, community partnerships, and advocacy efforts to advance an anti-racist, equitable future. DCFPI is a co-chair of the Strengthening Families Through Behavioral Health Coalition. The Strengthening Families Health Coalition brings together a diverse group of advocates who share a commitment to improving DC's behavioral health care system for children and families. Today, DCFPI urges the Health Committee to invest an additional $2.4 million to stabilize community-based organization grant funding, provide $300,000 to fund a cost study to determine the actual costs and needs of the district's school-based behavioral health program, adequately fund the community of practice, invest in a workforce pipeline of culturally competent clinicians, and expand information sharing and family engagement efforts. Because of time, I'm just going to highlight the first two recommendations, which people before me also testified, but just really want to reiterate that the council needs to stabilize CBO grant funding. Now more than ever, children are still really reeling from the trauma and the stress of the pandemic. And as Mark shared, in the last 2 years, the mayor and the council have made it possible for DBH to provide a higher grant per clinician at schools, which we know is super important if you consider the fact that Tier 3 services have declined. In DBH's performance oversight responses, they shared that, Tier 3 services went down by about 50%. And we know that CBOs have leaned more into providing Tier 1 and Tier 3 services, Tier 1 and Tier 2 services, which are not billable by Medicaid. And that does put a financial strain on our providers. And so we feel that the city should at least give CBOs what they've already been receiving the last 2 years. And then, as other folks testified about, we also think that we need to do a more robust cost study to estimate what we need. The rates were set, back in 2016. Rates have not been adequately adjusted for inflation. And I just think that if we want to make sure that we can get to our goal of at least one in every school, and then think about adding even more on top of that, we have to make sure that the CBO grant amount is attractive to providers, so that students can get the supports that they need. And then, we definitely are encouraged by the mayor's additional investments, but we got to make sure that we get some of the other pieces right, so that we can maintain the progress that we've made in recent years. So as always, Mr. Chairman, thank you for listening to my testimony, and I'm happy to answer any questions.
Thank you very much, and thank you very much for the brevity of your testimony. I appreciate it. And I think you've met with some of our staff already. That's helpful to know. Always beneficial to me to be able to have that kind of input. And we'll look forward to seeing what it is that we can do additionally to support the requests that you and others made. So thank you so much for your testimony.
Thank you.
Welcome. Tammy, are you here?
Yes, I'm here.
Okay, go right ahead with your testimony, Tammy.
Great, thank you. Good morning, Chairman Gray. My name is Tammy Wersinga-Cote. I'm the supervising policy attorney at Children's Law Center and a resident of the district. I'm testifying today on behalf of Children's Law Center, which fights so every DC child can grow up with a stable family, good health, and quality education. Children's Law Center is also a co-chair of the Strengthening Families Through Behavioral Health Coalition, a diverse group of advocates who share a commitment to improving DC's behavioral healthcare system for children and families. Last spring, the mayor and the council made significant investments in the school-based behavioral health expansion program, with the goal of placing at least one clinician in every DC public school in fiscal year 2022. Currently, however, less than a quarter of the 91 schools in cohort 4 have hired clinicians. There are several reasons for this, but the program's struggle to hire and retain clinicians is fundamentally rooted in the fact that this program is not sufficiently or sustainably funded. The program funds clinicians in schools through an annual grant of about $70,000 to various CBOs. For the past 2 years, the council supplemented these grants with one-time dollars to ensure they were sufficient to enable CBOs to do the work. For many CBOs, these supplemental funds were necessary to make participating in this program financially feasible. And without them, DBH would have found it even more challenging to place clinicians in schools. To be clear, $70,000 grants are simply not sufficient to enable CBOs to place a clinician in every DC public school. This is true for several reasons. First, costs for providers have steadily increased over the past few years, and yet the grant amount has not changed. Second, workforce shortages are driving increases in clinician salaries. There is a nationwide shortage of mental health professionals. The same is true here in DC. The public's overall demand for mental health treatment has increased exponentially during the pandemic, and more programs and sectors across the city are looking to behavioral health supports to address social problems such as community violence. CBOs cannot hire clinicians to work in schools if they cannot pay them competitive salaries. The Medicaid reimbursements that the current funding model depends on are also not consistent across all schools. The current grant amount is based on a certain percentage of the clinician's time being billable to Medicaid through Tier 3 services. But different schools have different needs, and some schools need their clinicians to prioritize Tier 1 and Tier 2 work. Further, many aspects of Tier 3 services aren't billable when you are providing services to children. For example, a counseling session with a child may be billable, but following up with that child's parents and their teacher may not be. As a result, the billing expectation isn't always achievable, which means CBOs are operating at a loss in some schools. This is not sustainable. Although the mayor's proposed budget appears to include $3.8 million for school-based behavioral health services, these funds have been designated for hiring even more clinicians, adding new DBH staff, and boosting workforce pipeline efforts. These are all valuable new investments, but the mayor's proposal also cuts provider grants by about $10,000 apiece, back down to $70,000 per clinician. While we certainly support expansion of the program, it should not be done at the cost of undercutting the existing core. We therefore urge the council to commit $300,000 in one-time local dollars to fund a study to determine what it actually costs to implement the school-based behavioral health program now and in the future. To bridge the gap while this cost study is conducted, we ask the council to reverse the mayor's cuts and restore CBO grants to the financially sustainable level of $80,000 per clinician for a total investment of $2.4 million in additional recurring local dollars in the fiscal year 2023 budget. By doing this, the council will both preserve the progress we've already made and pave the way for the continued expansion of the school-based behavioral health program DC students need and deserve. Thank you for the opportunity to testify today. I welcome any questions the committee may have.
Thank you, Tammy. I think you met recently with some of my staff, you and your colleagues, that was some of my staff. So we appreciate the value of that input. And we'll certainly take that into consideration as we try to figure out, what we do with the proposed budget from the mayor. Okay.
Sounds good. Thank you.
Okay. Thank you so much. Is Carrie Savage here?
I'm here. Hi, Councilmember.
How are you there, Carrie?
I'm doing
Go right
well.
ahead with
How are
your testimony.
Thank you. So good morning to you and to the members of the Committee on Health and committee staff. My name is Carrie Savage. I'm the Director of Policy at PAVE, and we are also a member of the Strengthening Families Through Behavioral Health Coalition. PAVE parent leaders have been steadfastly advocating for school-based mental health since 2018. They've been tirelessly advocating for their collective vision, an education system that prioritizes student mental health and wellness, where all students and their families have readily accessible, high-quality school-based mental health services, supports, and education that is responsive to student needs. During this hearing, you'll hear from many PAVE parents, Ms. LaTanya Graham, Randy Grant, Taisha Andrews, Kalita Boyd, Renee Davis, and more, and other parents have left voicemails and will be submitting written testimony, all calling you for similar things. We want to make sure that we first thank the council for funding last year to make sure that every school had at least one clinician in every DCPS or public charter school, and for finding the funds to provide CBO clinicians with stabilized grants for works in school this year. As many of my colleagues have mentioned, those grants are critical for providers to be able to stay whole and provide high quality services to our kids. We want to thank the mayor's initial investment of $3.8 million for this current budget. We know larger investments are crucial to continuing the expansion program. However, we want to make sure that that funding is directly targeting to the school level. So while wraparound services, additional clinicians, infrastructure are all important investments, we're missing the mark on what families and communities have consistently called on in terms of funding around this program. We know that when the model is funded well and implemented well, it works. But the mayor's current investments do not address many of our schools and CBO's challenges that we need to implement this well. So that's what I will focus on today. First, right-size the grant amounts for our CBO clinicians at a level of $80,000 per clinician. Right now, we are effectively making CBOs experience cuts, given that we are operating off of the rates from 2016, and we are going back on the advocacy of so many from last year, calling for those increases.
Next, we need to provide at least $300,000 to fund a cost study to determine the correct cost of school-based mental health program now and in the future to best support the crucial work of our clinicians. This is the epitome of a work smarter, not harder strategy. It is well worth this investment so that we can make targeted, high impact, and long-term investments in planning to make sure we're supporting our kids. And lastly, make sure we are creating a strong accountability system. This accountability system should be fostered and supported by the DC Council and the Committee on Health to ensure that DME and DBH do not continue to work in silos and in separate rooms from school leaders, parents, and students. We need an information campaign and investments to make these opportunities for parents and students to get engaged in this system and make them accessible. There has never been a more important time to have a laser focus on supporting students' mental health. These supports are foundational to their learning, to reaching their potential, and to achieving their dreams. It is essential to promoting public safety and to giving young people the tools to cope and heal from the myriad of challenges and trauma they face. This work is only possible with leaders on the council and in DBH who also believe in the power and promise of student, parent, and community voice. Thank you so much for the opportunity to testify today.
Thank you very much, Carrie, for your testimony, and thank you for PAVE. I've been a supporter of PAVE for some time, as I'm sure you know. Excuse me, as I'm sure you know. So we'll look forward to looking at the requests you've made and with your colleagues who have joined you your testimony today. So thank you so much for your testimony.
Thank you, Councilmember.
Welcome. All right. Is Joshua Hodge here?
Yes, I am, Chairperson Gray.
Joshua, how are you?
I'm very well. How's your day going so far?
Okay. Go right ahead with your testimony. And you know what the limitations are in the testimony, and most people have been gracious enough to observe that for us. So thank you so much.
Of course, Chairperson Gray. Hello and good morning, Chairperson Gray and the Committee on Health. My name is Joshua Hodge. I'm the Policy and Communications Manager at Education Reform Now DC, a Ward 6 resident and a member of the Strengthening Families Through Behavioral Health Coalition. I'm pleased to provide testimony today at the Department of Behavioral Health's Budget Oversight hearing. We are asking for the Committee on Health and DC Council to increase community-based organization clinicians grants to $80,000 and fund a full cost study of the SBBH program so that DC can finally right-size the cost of this program for students. First, we are very grateful for the mayor's continued investments in the SBBH program. The mayor proposed $3.8 million to help support the program. That $3.8 million provides funding for additional clinicians, program infrastructure, data oversight, and wraparound services. These are crucial investments, and if withheld, many students would not receive the supports they need. We are asking for the DC Committee on Health and DC Council to raise CBO clinician grants from the mayor's proposed $70,000 to $80,000 so that CBOs are able to provide needed services in schools. Without additional funding to permanently stabilize CBO grants, it will be difficult to retain clinician workforce that we have fought so hard to get and fill in current open positions. The district should maintain grant levels from the current fiscal year and for the next 3 years and include increases to cover the cost of inflation. The difference in funding from the mayor's proposed investments in the program to what is needed is about $2.4 million. The DC Committee on Health and Council should also fund a cost study, which is estimated to be $300,000, so that DC can finally right-size the program and ensure that all students' needs are met. Behavioral health services have been crucial for student success in schools, but these needs have been exacerbated by the pandemic. And these needs will continue to persist as we are not headed towards a post-pandemic world, but instead a new era of COVID life that directly affects schools and student well-being. Since the start of the pandemic, emergency department visits for children with mental health emergencies has risen sharply. Tens of thousands of students have experienced a pandemic-related death of a primary caregiver across the world, country, and right here in DC. In October of 2021, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association declared mental health a national emergency for children and adolescents. As we know, the pandemic has not impacted communities the same, with many Black, brown, and low-income households being affected more severely by the effects of COVID-19, which ways include financial losses, housing instability, long-term health repercussions, physical sickness, loss of family members, and decreased overall mental health. Increased access to behavioral health services is proven to be transformative for students and their families, and can boost the long-term health and productivities of our communities, as evidenced by school-based outcomes, overall health, and reduced crime. Behavioral health is foundational to the district's long-term recovery impacts of the pandemic. In closing, district leaders have an opportunity to deepen investments and focus on students to continue to address some of the most severe issues facing our youth, presenting the chance to create a behavioral healthcare system that is more just and equitable for DC students and their families. Thank you so much for allowing me to testify today.
Joshua, thank you very much for your testimony. And, some of your colleagues have testified as well. And we'll look forward to looking at that testimony as we try to evaluate, the mayor's budget and, how we go forward with what's been proposed. Let me ask you a question from the perspective of your work that you do with your colleagues. Have we been able to recruit the number of clinicians that we were looking to recruit and bring on board? And I'm asking you this on behalf of yourself and those that you represent also.
Yes, thank you so much for the question, Councilmember Gray. As of right now around recruitment, I believe we're doing a very good job with that. However, more definitely needs to be done along with the funding required for that as well.
All right. Well, we're obviously evaluating the testimony being provided today. My staff has met with, not necessarily you, but maybe those you represent and your colleagues. And we'll look forward to evaluating what's been said to us and how we go forward with this. So thank you, Joshua, and to your colleagues also.
Thank you very much. Thank you.
Welcome. Thank you to PAVE and all the other organizations that have worked so hard with us to be able to get to where we are today. And I heard the request about a cost study, which you stated, and Carrie Savage and others have included in their testimony today. So thank you all very much. I appreciate it.
Appreciate you as well, sir.
Okay. All right. Move to our next panel. Is Betty Gentle? Are you here, Betty?
Yes.
Hey, how are you today?
I'm good. How are you?
I'm pretty good. Want to go ahead with your testimony?
Yes. Greetings, Chairman Gray and members of the committee. My name is Betty Gentle, and I'm the Senior Advocacy and Community Engagement Specialist at SCUM Incorporated. Thank you for the opportunity to testify. SCUM is a member of the SUD Provider Coalition, the DC Behavioral Health Association, and the Fair Budget Coalition. We strongly support the comments and recommendations presented on behalf of all DC BHA members and the Fair Budget FY23 healthcare budget priorities. To fulfill SCUM's mission of breaking the cycle of homelessness, we quickly learned that offering services that give residents the opportunity to address their behavioral health needs was a necessity. Our partnership with DBH helps make this possible. Therefore, we are deeply invested in a high-performing DBH that is responsive to the diverse needs of our consumers and adequately funds providers so that we are all able to continue serving DC residents with individualized whole person care. SCUM is happy to see the mayor's behavioral health investments in programs such as 911 Aversion, the community response teams, and the school-based mental health program. However, as SCUM offers its testimony, we must express that we have many remaining questions about the DBH budget that we hope will be answered through the committee's question of Dr. Badron and her team. Our gravest concern is whether this budget includes funding for rate increases for any DBH certified provider organizations or even an inflationary increase to adjust to the rising costs. During the FY22 budget oversight hearings, some and several providers expressed that the financial viability of programs were in a critical position and that providers could not adequately sustain programming without financial support from DBH. Unfortunately, this is not substantially improved, and even more, the provider network urgently needs these overdue rate increases. After all, as you've heard, we are operating on 2016 rate costs in 2022. Additionally, some and other organizations know that this insufficient funding also contributes to the difficulty of successfully recruiting and hiring qualified and licensed people to work on site because of the salaries we can offer, especially during this time of a local and national healthcare workforce shortage. It is imperative that this FY23 budget include funding for rate increases for DBH certified provider organizations, and we ask that the council ensure that the funding in the current proposed budget is added to the final FY23 budget. Last, some supports the ask of our coalition partners regarding school-based mental health and asking this committee to ensure that the final DC budget restores CBO grants to $80,000 per clinician and funds a $300,000 cost study to ensure the successful perpetuity of the program for all DC students. We are asking that the council ensure that the final FY23 budget includes funding for rate increases that reflect the actual cost of providing behavioral health services in the community and in schools. All DC adults and kids deserve and need a strong publicly funded behavioral health system, and this system cannot properly function without strong, financially grounded, community-based providers. Thank you.
Thank you, Betty. We appreciate your testimony and, of course, the support of those you represent as well. So we've heard your testimony and that of others today, and we will certainly be looking at that, taking that into consideration as we try to make our decisions at this point about the mayor's budget. Okay?
Thank you.
You're welcome. All right, Mark Miller. Mark, are you with us? I think you are. I think I see you on the.
I'm with you, Chair Gray.
How are you?
I'm good, thank you. You're looking well. So
thank you.
Good afternoon, Chair Gray and members of the Committee on Health. My name is Mark Miller. I'm the DC Long-Term Care Ombudsman with Legal Counsel for the Elderly, and I live in Ward 3. DBH, as you know, monitors and licenses about 90 community residence facilities for adults with a primary diagnosis of mental illness and is responsible for ensuring the provision of mental health support services for these residents through contracts with core service agencies and ACT teams. My testimony today is going to focus just very briefly on 4 areas that require DBH to have sufficient funds to fulfill their mission on behalf of these residents. Ensuring sufficient DBH staff to monitor CRFs, ensuring sufficient transitional housing opportunities, ensuring adequate training for CRF staff, and reducing inappropriate discharges. We support a budget that allows DBH to adequately oversee these homes, ensure compliance with regulations that protect residents, and that can quickly and effectively identify and address problems impacting residents' care and their rights. If this requires additional staff, we recommend a budget that includes funds to accomplish this essential monitoring and oversight. Secondly, as you know, Chair Gray, CRFs were originally conceived as a temporary housing and support option for residents to transition to more independent housing. We applaud and support the city's proposed budget that which provides an increase in the number of housing vouchers that would be made available to help these residents move to greater independence. In addition, my office recommends funding for a study of the effectiveness of transitioning residents to less restrictive placements. The study could identify the number of residents who have successfully moved to independent settings, as well as identifying any additional supports which are needed to maintain and increase these moves, which again should be the primary focus of the CRF's work. Thirdly, we need to ensure adequate mental health training for CRF staff. For staff of the various types of CRFs, we urge that the budget include sufficient funds for needed training. Providers and their frontline staff must have access to ongoing mental health training. Training is not only necessary to ensure that staff can effectively intervene and de-escalate situations, but also provide the day-to-day therapeutic services that these residents need. Finally, our office continues to advocate against provider-initiated discharges, which are unsafe and do not comply with DC law. Per previous testimony, our office has been working with DBH to revise a model discharge plan, which would ensure All parties, including providers and ACT teams, provide consistent and appropriate support to residents throughout the discharge process. Our office can inform the council today that DBH is close to finalizing this plan, and we look forward to working with them to implement this in the future. I'm happy to answer any questions that you have and appreciate the opportunity to testify before you today.
Thank you, Mark. Thank you for your testimony and your consistent engagement over the years, with us. The plan that you mentioned, when is that going to be available, Mark?
We've been working with DBH pretty closely in the last month or so, so we're pretty close to having that done. Basically, what it's going to do, Chair Gray, is make sure that residents' rights to appeal in a discharge issue are clearly known to them, and also establish a clearer process for what has to be done to help people when they're going to transition from a CRF into the community. So I'm hoping that we're really close to that.
Well, we'll ask Dr. Bazran when she comes up if she can, speak to the issue of the continued work towards the readiness plan that you talked about, and we'll look forward to being able to get a copy of that plan. And I'm hopeful that this thing is moving along, that it can happen during this period that we're evaluating the budget also, and see how we move from here.
Right. And I think, looking forward, I really think kind of an effectiveness study is, it would be appropriate to look at, is DBH and are the CRFs really doing the job that we're paying them to do, which is provide mental health services and supports that enable people to move into a more, independent, less restrictive setting.
Yeah. Well, you've been absolutely consistent over the years in your engagement on this issue, and we'll look forward to continuing to work with you, Mark, and we'll certainly look forward to getting a copy of that plan and evaluating it ourselves as soon as it's available. Okay.
Great. Thank you so much, Chair Gray.
You're welcome. Okay. Is Justin? Are you here? Justin Palmer?
I'm here. Can you hear me?
How are you, Justin? How are you? I sure can. Go right ahead, Justin.
Good afternoon, Chairman Gray, members of the Committee on Health. My name is Justin Palmer. I'm the Vice President for Public Policy and External Affairs for the District of Columbia Hospital Association. I appreciate the opportunity to present testimony at the Department of Behavioral Health's FY23 budget oversight hearing. Ensuring the district is meeting the behavioral health needs of its residents is essential to ensuring that individuals are able to thrive in our city. The pandemic has highlighted the importance of continued investment in behavioral health services. This includes ensuring providers are properly and sustainably compensated for their service, and building and maintaining the necessary capacity of outpatient services to prevent patients from going into crisis and to support them in a timely manner should they need stabilization. The district's hospitals provide vital stabilization services for those that need them, but it's in the patient's best interest to receive the needed supports in their community. The mayor is making significant investments in the department to improve the resources available to residents of the District of Columbia. The continued investment in school-based resources and wraparound services is essential in improving the supports for students, as well as their successes in and out of the classroom. We are in support of the continued investment in the Sobering and Stabilization Center and are quite excited about the department's efforts in this area. As I testified before, this resource will keep individuals at the right level of care and without unneeded trips to a hospital. The budget books indicate a reduction in local funds for mobile crisis services for children and youth, as well as stabilization beds. It is critical that any reduction in local funds to mobile crisis or stabilization beds is met with investment from other funding sources. Our pediatric providers have seen an immense increase in pediatric hospitalizations over the last 2 years, and we must ensure that services are available when they are needed. We have seen increased boarding in the emergency departments because pediatric behavioral health beds are not available due to this increased demand. In the same vein, the district and the department must continue to expand capacity and availability of CPEP resources. Thanks to the department's reopening of additional beds last year, we have seen a decreased number of diversions from CPAP. This investment was an important start, but investing in additional locations and beds will be critical as we increase capacity for stabilization beds outside the hospitals. We also support the one-time operational and additional capital investments at the St. Elizabeth's Hospital. The district's public psychiatric hospital plays an essential role in the behavioral health system in the district, and we need to ensure investments are being made to safeguard the hospital's ability to continue to meet the needs of its patients. This includes the ability to care and treat for our forensically involved patients, as well as those in need of civil commitment. Thank you for allowing me to testify today, and I'm happy to answer any questions.
Thank you very much, Justin. You were right on time with your testimony. We appreciate it. You must have timed it out, and we appreciate it. And we've heard what you had to say. And please tell your director, Ms. Bowen, that we appreciate the work of the Hospital Association in helping us to get to where we've gotten to with the building of a new hospital on the east end of the city. It's going to take up to probably 2 years to get it finished, but we're on our way. We've had the groundbreaking, as you know, and I'm very excited about that and the healthcare system that we're creating as a result. So I hope you guys will join with us in being able to celebrate that and work to make sure that it is built the way we want it to. So thank you so much, Justin.
Thank you, and I will share that with Ms. Muffins.
I appreciate it. Okay. Jared Bowman, are you here, sir?
He is not.
Okay, Jared did not make it, okay? Maybe he will show up. Okay. The Councilmember George, is she able to get back with us?
She is not.
Okay.
But she plans to join later.
Okay, thank you. All right, Jacqueline Werner. Jacqueline, are you here?
I'm here. Can you hear me?
Yes, I can. Go right ahead with go right ahead with your testimony.
Thank you. Good afternoon, Chairperson Gray and committee members. Thank you for this opportunity to testify. My name is Jacqueline Werner, and I am a staff attorney at Disability Rights DC at University Legal Services, the designated protection and advocacy program for people with disabilities in the district. Pursuant to our federal mandate, Disability Rights DC advocates for hundreds of DC residents with mental illness each year. I'd also like to thank the DC Bar Foundation for supporting our efforts to address housing barriers experienced by district residents living with mental illness. My testimony today is focused on DBH's continued failure to allocate adequate housing resources for individuals who are housing unstable or experiencing homelessness and living with serious and persistent mental illness, as well as DBH's failure to hold its certified providers accountable. First, DBH is continuing to fail in allocating adequate housing resources to its consumers. We've testified about this before, and it continues to present a significant challenge for our clients. Mayor Bowser has again made a historic investment in housing in the district, including by investing $31 million in Homeward DC and $41 million for project-sponsored vouchers for deeply affordable housing. We are thankful for this and are encouraged by it. However, we continue to have concerns that a significant portion of this money will not go to housing those with the greatest need, particularly those individuals living with serious mental illness and other disabilities who rely on SSI to meet their basic needs. This will be elaborated on in my written testimony. We continuously see our clients' community support workers and ACT caseworkers be unfamiliar with local housing resources and fail to understand their obligations to connect their behavioral health consumers with housing resources under DC regulations and DBH policy. It's well understood that in order for anyone to be able to focus on their mental well-being, they must first be safely housed. We continue to urge DBH to hold its providers accountable in doing this. We also continue to urge DBH to expand its housing continuum for its consumers, rather than narrowing it as it did, for example, by ending its contract with supported independent living programs last year. Second, and related to above, we would be remiss if we did not share with you our dismay at the poor quality of services in the district's behavioral health arena at present. Our office receives a stream of phone calls from behavioral health consumers who complain that their CSAs provide few to no community support. Every week, we have evidence of lost housing applications, caseworkers who simply disappear and don't alert their clients, medication that isn't renewed, underperforming ACT teams, a failure to coordinate with other agencies, and the neglect of medical needs. It's our view that DBH has an obligation to set and enforce values and practices to ensure that agencies actually provide the services for which they contract. Yet we find that our complaints, grievances, and concerns to DBH are often only given lip service. We suggest that DBH invest in its accountability division and that it make a commitment to monitor and to train providers to ensure that the budget is well spent and that district residents with behavioral health needs are not neglected. Thank you for this opportunity to testify, and I welcome any questions.
Thank you, Jacqueline. You were right on time with the testimony. We appreciate it very much. And we've worked with you all over the years. You all have brought valuable testimony to the committee, and we'll continue to do what's necessary to try to effectuate responses to the kinds of things that you all have raised. So thank you so much, and please tell your colleagues we appreciate the work that they do, okay?
I appreciate it. Thank you so much.
Okay. Is Tammy Seltzer here? Tammy?
She is, sir.
Okay, Tammy.
She's just unmuted herself.
Okay, we're gonna give her a chance to get unmuted and to provide her testimony. Are you unmuted yet, Tammy?
I have. Good afternoon, Chairman Gray.
How are you?
I'm good. How are you? It's been a while.
I'm doing okay. We are delighted to have you and look forward to your testimony.
Thank you, Chairman Gray and members of the committee. I'm Tammy Seltzer. I'm Director of the Jail and Prison Advocacy Project, or JPAP, at Disability Rights DC at University Legal Services. I'm also a Ward 1 resident. JPAP supports the recommendations and testimony that you're going to be hearing from the District Task Force on Jails and Justice submitted by the Council for Court Excellence. But we want to emphasize that these increased resources must also come with increased accountability and transparency. As formerly incarcerated DC resident and JPAP client Donald Hines will testify, significant targeted community investments are essential to breaking the district's trauma to prison pipeline. We must both support people already in the system and prevent individuals from ever entering. Most necessary community investments are the responsibility of DC agencies other than the Department of Corrections. Although DOC runs the jail, DOC is not responsible for the egregious overrepresentation of Black individuals, people diagnosed with psychiatric and intellectual disabilities, and those who struggle with substance use disorders. Nor is DOC responsible for how many of our city's residents are caught in the criminal legal system's web due to significant trauma that is usually unaddressed at any point in their lives. Every city agency should have measurable goals and specific funding to decrease the likelihood of someone becoming involved in the criminal legal system. DBH plays a particularly important role in prevention and early intervention. We must start before children are born, such as investing in pregnant residents diagnosed with mental illness and/or substance use disorders, and supporting families whose caregivers have a mental illness and/or an SUD. Two of the adverse childhood experiences, or ACEs, that increase the risk of violent behavior and incarceration. The New York Department of Corrections is using TAMAR, the trauma program that DBH has wisely contracted to use in the jail. And in a video about the program, Healing from Inside Out, one individual likens trauma to plumbing, observing that pressure breaks pipes, and pressure breaks people too. That's the point. Unaddressed trauma affects close to 90% of all people incarcerated and 100% of incarcerated people with psychiatric disabilities. There's a direct link between childhood abuse and neglect and involvement in the criminal legal system. We can, with the right investments, break the cycle and build resilience. How do we know if we're making the right investments? DBH must track and share outcomes so we can see which investments and providers are effective and which are not, which can be improved and which should be scrapped. Service quality varies widely from excellent to negligent, and DC's most vulnerable citizens should not have to depend on the lottery to determine which kind of services.
Your testimony, and Just, well, I'm sure you're aware of the proposals that have been made by the mayor, in this budget. You may be aware also that when I was mayor, we had proposed also the construction, not just the construction of a new jail, but the inclusion of a major educational component in that. And we hope that that will be a part of what goes on in the new jail that's going to be built. So I hope that you all will continue with your advocacy and continue to work with us as we try to help to eliminate the problems of people being undereducated, who come through the jail system, and when they get back, going back into society, that they will be, hopefully they will be better equipped to be able to fend for themselves and work effectively, in our society. So thank you so much for your advocacy, and we'll look forward to continuing to work with you. And I certainly will be myself participating in the hearing about the new jail. So we'll look forward to it.
Thank you, Chairman Gray.
Welcome. Is Donald Hines with us? Donald, are you with us?
He is, sir.
Okay.
He just needs to unmute himself and turn his camera
Unmuted,
on.
how's that?
Sir Chairman, I'm with you.
Okay, Donald, are you ready to testify? We'll give you a second to get completely
Good evening,
unmuted.
Chairman. Can you hear me?
I can hear you now, sir. Go right ahead, Donald.
Hello?
You there?
Yes, sir. Can you hear me?
I can now. Go right ahead with your testimony.
Okay. Good evening, Chairman Gray. Yes, sir.
How are you?
Good evening, Chairman Gray and members of the committee. My name is Donald Hines, and I'm a returning citizen and client of the Disability Rights DC at University Legal Service and a resident of Ward 5. I thank Mayor Bowser for the money she added to the Department of Behavioral Health's proposed FY23 budget. While I am thankful for the increased funding, the needs of the district communities are many, and this does not yet come close to meeting them. I'm here today to emphasize the importance of investing early in our community use and the massive impact that DBH programs can have on minimizing and preventing trauma, incarceration, and other negative life experiences. I was first incarcerated when I was 11 years old. Since then, I've spent much of my life in and out of prison and was just released some 10 months ago. I want to tell you about my childhood and the circumstances that led me down this path. I grew up in a low-income household. My dad was an alcoholic and frequently beat my mom. As the eldest of 3 children, I bear the brunt of my family's situation. I felt unsafe in my own home. Even though I liked school and received good grades, I soon lost interest in my education and dropped out. At this time, my 15-year-old cousin was living with us and introduced me to alcohol, marijuana, and heroin. I soon found myself heavily consuming these substances. This lifestyle eventually landed me in prison and began a cycle of incarceration. From reflecting on this period of my life, I believe that if I had more community support and resources to negate my family situation, I wouldn't have found myself taking a much different life path, a path that would not have placed me behind bars for years of my life. I experienced several adverse childhood experiences. I lived with a parent who abused substances. I also experienced firsthand violence against my mom. I believe my dad also experienced ACEs when growing up. This upbringing caused him to develop mental health issues and exhibit abusive behaviors in my childhood household. He didn't have the resources or programs necessary to prevent his own trauma from affecting his behavior around his own children. The generations of trauma that have perpetuated in my family, along with other individuals in similar situations, need to be stopped. DBH can implement programs that can shatter this cycle. If these services had been provided during my formative years, I strongly believe that I would not have dropped out of school, heavily consumed drugs and other substances, and spent much of my life in prison. I don't want to see any other young children and adults go through these same experiences. I'd like to thank you for giving me time to share my experiences with you today, Chairman. And if you have any other questions, I'll be sure to answer.
And the difficulties that you've endured over the years. And, you know, some of the programs, the services that we're implementing now are efforts that that we hope you will support, given your childhood challenges that you've had. So we'll look forward to continuing to work with you, okay?
Okay, sir. Thank you very much.
You're very welcome. And I think Councilmember Lewis George has rejoined us. Councilmember, good morning, good afternoon now. How are you?
I'm good. Thank you, Chairman Gray.
Okay, would you like to make an opening statement and then have a round of questions with this group of witnesses?
Sure. I think I missed some of the testimony of this panel, but I'll do my opening statement now. And then most of my questions will be directed towards Dr. Bazron and DBH. But thank you, Committee Chairman Gray, for convening today's hearing with the Health Benefit Exchange and Department of Behavioral Health. I am not on this committee, and so I thank you for welcoming me today. And thank you to all of our public witnesses for joining today and setting the tone of continuing to push us to meet the moment in advancing a just recovery with our budget priorities. Mental health and emotional well-being were already major concerns in a city with such stark inequalities. But after 2 years of social isolation, disruption of routine and city services, deepening poverty, anxiety about the future, the work of behavioral health professionals in our city is more critical than ever. And similarly, making sure we are tending to the financial, physical, and emotional well-being of our behavioral health workforce is vitally important for sustaining our dedicated city workers who give so much of themselves every day. I am glad to see the DBH budget is increasing investments in school-based mental health services and growing the staffing capacity of the community response teams. But I will want to dig into these two programs further to get a clearer picture on how funds will be used, what the per clinician grant amount is, and how additional staffing will be assigned in schools and communities. And, you know, I strongly believe the district should be hiring licensed and independent clinical social workers. And we need to be investing in positions and people that will be able to be with our schools for the long haul, not relying as heavily on graduate social workers. While great, we can't rely heavily on them because they often have high turnovers as they are obtaining credentials and subsequently, you know, go and look for higher paid positions. And we need that stability in the workforce, especially in our schools, and given the positions that they critically serve. Something I brought up at the DBH Oversight hearing last month was the need to grow our pipeline of social workers and direct care professionals to meet the need in the city. And, you know, we know this is a matter of a national shortage of behavioral health professionals. And still, I like to know, you know, even with that, what the city is doing and getting as creative with mental health professional pipelines, and hoping we're getting as creative with the mental health professional pipelines as we are getting with the policing pipelines. We need to be doing everything in our power to incentivize hiring in every part of our city services, which impact public safety. And that starts with investing in the social emotional development and resilience of our youngest residents, because we know that early childhood experiences chart the course of our kids' future and mental behavior health and have a direct impact on the future public safety risk factors and overall community well-being. And so to that end, I hope we'll be able to discuss hiring incentives, retention incentives, recruitment plans, workload, and attractive pay for the DBH workforce, including for the nurses working at St. Elizabeth's and nurses elsewhere in DBH. I also want to be sure I understand correctly all the intra-district staffing changes, federal grant plans, and decreased budget lines for early childhood services, because again, those early emotional foundations that the Healthy Futures program helps support in our childcare facilities are so important. So I am looking forward to learning more from Director Bazaron and all of our public witnesses today. And I want to thank you, Chairman Gray, for allowing me to join the committee's discussion today. I also want to thank Director Bazaron for being literally on screen this entire time. This is the first hearing where I've seen a director literally directly listening and engaging and hearing that testimony. And I just think it's phenomenal. And so I just want to say, like, I've just been, you know, I want to thank you for being here and listening to the public in the way that you have shown up and are being here. So thank you again. And I look forward to some more questions. And thank you to all of the witnesses who are testifying, who are part of this network of caring for our families and our students especially. Thank you.
Councilmember Lewis George, we appreciate you being here with us today. And Dr. Bazaron has been on from the beginning of our hearing engagement earlier today. So not only for the witnesses, the public witnesses for her agency, but also the engagement we had earlier with other witnesses about the healthcare exchange. So I want to thank you for being here today. We're delighted to have you, and continue to join us. All right, we're going to, let's see, I think Jennifer, I may mispronounce this. Is it Ubira?
Ubiera.
Is that correct?
It's Ubiera.
Okay, great. We'll look forward to your testimony. So go right ahead.
Thank you. Good afternoon, Chairman Gray and Councilmember Lewis George, and members of the Committee on Health. Thank you for the opportunity to testify today. My name is Jennifer Ubiera. I am a senior policy counsel at Council for Court Excellence and a Ward 4 resident. CCE is a 40-year-old, nonpartisan, nonprofit organization with the mission to enhance justice in the District of Columbia. Please note that per our policy, no judicial member of CCE has participated in the formulation or approval of this testimony. I am also a member of the Strengthening Families Through Behavioral Health Coalition, and CCE facilitated the District Task Force on Jails and Justice. I am here today to discuss several budget investments that will serve DC's most vulnerable residents and help ensure that people with behavioral health needs have access to the services necessary to thrive. I would like to affirm earlier support for the Council to invest $2.4 million into the school-based behavioral health expansion program to stabilize CBO grant funding and $300,000 to fund a cost study. The Mayor's current budget proposal suggests lowering grant amounts from $80,000 to $70,000, which is unsustainable for current CBOs to perform this critical work in our schools. Grant amounts must remain at $80,000 to fully realize the benefits of this important program and sustain its success. Secondly, CCE supports DC Behavioral Health Association's ask to increase funding for community-based behavioral health services and housing by $12 million. In addition, we ask for a $2 million increase to expand the use of the Housing First model among re-entry housing providers as recommended by the task force. This investment will fund new housing and case management services for 55 more residents in FY23 returning to DC from prison or jail. I would also like to call your attention today to DBH's Community Response Team's pre-arrest diversion and 911 diversion projects, both of which were recommendations of the task force. Specifically, I am here today to urge the committee to increase funding to DBH's CRT overall by $15 million to provide for enhanced provider and NPD training, workforce development, and worker recruiting and retention. The CRT's current operational capacity does not allow the team to respond in a timely manner to all cases that might be and should be eligible for PAD's alternative intervention model, or to support the law enforcement trainings and collaborations that are critical to making the program a success. During the 911 diversion pilot from June to September 2021, OUC never diverted more than 28 calls per week and sometimes as few as 5 calls per week to DBH. An advanced screening mechanism, in conjunction with the fully staffed and funded CRT, provides a chance to help these individuals before circumstances escalate before more serious crimes are committed, and before they end up incarcerated and at worst, killed.
Going that way again today, man. So, yeah.
DC should be standing up a career pipeline for non-law enforcement responders like peer specialists and violence interrupters in the same way we do the MPD Cadet Corps. Finally, CCE recommends increased local dollar funding to increase non-Medicaid billable services to support justice-involved consumers. Between 2015 and 19, almost 48% of people in DOC custody had a documented substance use disorder. And of those, people who received SUD care after their release from DOC custody had a 36% lower chance of being arrested or reincarcerated within 90 days. Based on our research, CCE requests a $10 million total investment in services for justice-involved people in SUDs in FY23. Thank you for the opportunity to testify today. I'm available for any questions.
Very much, Jennifer, for your testimony today. And as you know by now, I'm sure the budget includes a commitment to building a new detention center in the District of Columbia. It's something that I have supported since I was a mayor, and I'm glad to see this happening at this stage. And I hope you'll be supportive, because I want to not only see this happen, but I want to see the investment of a commitment to education for people who are in our criminal justice system, and not become just a source of a pipeline, to continuing engagement with with a difficult life. So I appreciate your testimony. It certainly will be included in, my own work with the council as we go forward. So I hope you'll be testifying as well on what we do about a commitment to a new, I'll call it the jail, okay? And I hope that it will include a commitment to educational work for those who are incarcerated as well. So thank you, Jennifer.
Thank you, Councilmember.
You're welcome. Okay, I think Jared Bowman may have joined us now. Are you with us, Jared?
Yes, Councilmember. Thank you.
Okay, go right ahead with your testimony.
All right. Good morning, Councilmember Gray and members of the Committee on Health. Thank you for the opportunity to address the council as it conducts this budget oversight for the Department of Behavioral Health. My name is Jared Bowman, and I'm the Early Childhood Policy Analyst with DC Action and the Under 3 DC Coalition. DC Action provides data analysis, policy leadership, and collective advocacy on critical issues facing DC children and youth. DC Action is also a part of the Under 3 DC Coalition, which is committed to transforming how DC invests in infants, toddlers, and families starting prenatally through age 3. I would like to focus my testimony today on the importance of increasing investments in early childhood behavioral health supports for the thousands of young children in the district through DBH's Healthy Futures program. Chairman, as you know, Healthy Futures promotes positive, healthy development in DC's infants and toddlers. We are grateful for the council's continued commitment to the health and wellness of families in DC and for the ongoing support for the important mission of Healthy Futures. Healthy Futures, as you know, Chairman, focuses on offering early intervention consultation services to early educators and family members to build their skills and capacity to promote social emotional development, prevent escalation of infant and toddler challenging behaviors, and increase appropriate referrals for additional assessments and services. Unfortunately, however, the mayor's proposed budget does not include any investments in the Healthy Futures program, and we believe this is a tremendous oversight. Increasing funding for the Healthy Futures program by at least $700,000 will enable the Department of Behavioral Health to make much needed updates to the program's infrastructure, to hire personnel, and to increase their capacity to expand to 25 to 35 additional child development programs next fiscal year. We believe these steps will significantly advance the agency's efforts towards reaching all subsidy participating child care development programs in the district. There are over 5,000 infants and toddlers participating in the district child care subsidy program. As the committee well knows, child care is an essential public good, for working families and an important setting for identifying, assessing, and implementing developmentally appropriate goals and expectations for healthy child development. In 2021, Healthy Futures reached 87 child development facilities participating in the Child Care Subsidy Program. That includes 69 child development centers and 18 child care homes. The Healthy Futures program administered by DBH strengthens these early learning settings by building trusting relationships with teachers and families to help inform the way they promote healthy development and respond to challenging behaviors of the children in their care. Healthy Futures works with teachers and directors to build their capacity and their confidence. And through this work, according to DBH, of the approximate 5,400 children served in child development centers where the Healthy Futures program was implemented, only 2 of the 5,400 were expelled in FY21, and no children have been expelled in FY22 to date. This program demonstrates, in addition to this, that adult wellness and child wellness are interrelated. Last year, several parents and educators shared with the Under 3 DC Coalition some of the tremendous benefits that consultants have had on helping them deal with their own stress and anxieties, giving them tools and resources to deepen the adult-child connections by modeling behaviors that they hope to see in their little ones. DBH data shows that Healthy Futures clinical specialists provided 56 parent workshops focusing on self-care and understanding children's behaviors. They offered 316 parent consultations. And they offered 1,000 consultations, over 1,000 consultations with directors, and 24/7 staff workshops on managing stress, 247 staff workshops on managing stress and understanding children's behaviors. As you can see, when DBH receives adequate funding to support their growth and expansion, they're able to reach families in childcare settings. In fiscal year 2022, the Committee on Health allocated $416,000 to support the expansion of the Healthy Futures program in DC. We are grateful for this investment and have learned that the Healthy Futures team has plans to expand to 75 additional child development facilities this year, has hired 2 new supervisors, and 7 of the 11 new consultants needed to expand the program in FY22. They are also in the process of implementing an evaluation with an external contractor.
Jared, can I ask you to wrap it up?
Absolutely.
Appreciate it, man.
No problem. So, as the district, we've got to do our part to continue supporting the Healthy Futures program in FY23 and beyond. As I've said before, by increasing funding for Healthy Futures by at least $700,000, DBH can strengthen their program's infrastructure and ensure more Black and Brown children have access to this essential program in communities that are most often forgotten. Thank you for the opportunity to testify. I welcome your questions.
Thank you, Jared. I appreciate your testimony. And as you may know, I have been an unswerving supporter of early childhood education in the city. I did the legislation for the birth to 3 population in the city, and have been working closely with my colleagues to be able to get the additional money, federal money, into the city. I'm a big supporter of the Early Futures program, and will continue to do that as best as I possibly can. So I appreciate your testimony and that of your colleagues, and please assure them that we will do the best we can with this budget to try to create opportunities for young people, our very young people, very youngest of people, to be able to be effectively served. I certainly will be doing that as something that I've done for so many years, and I hope you know that I've made those kind of commitments and will continue to do so.
Absolutely. Thank you, Chairman.
Thank you very much. I appreciate your testimony. Let's see. I'm going to go back to our witness list at this point. Hold on one second, everybody. I think we're down to Nadia Gold Moritz. Is that right, Nadi? Is that right?
Yes.
Okay. And you've been before us before, so thank you for your testimony,
Yes, sir.
okay? And
Yes.
go right ahead with your testimony for the Young Women's Project that you are testifying for today.
All right. Good afternoon, Chair Gray. Thank you so much for the opportunity to testify. My name is Nadia Gold-Moritz. I'm the Executive Director of the Young Women's Project. I'm also Ward 4 resident and I have 2 kids in DCPS high schools. The Young Women's Project builds the leadership and power of young people in DC and puts them to work solving community problems. Our young people work on 3 levels. One is advocates. You've seen many of them in front of your committee, and you'll see some next week for the DOH hearing. They also work as community organizers, mobilizing their peers, and as infrastructure builders in the schools, mostly implementing programs. So we have 2 main programs. One is the Youth Health Educator program, which you've been a big supporter of for years. Those young people, we have 50 right now in the schools distributing condoms, doing sexual health education. And then we also have 60 young people doing mental health education and trying to connect young people to providers, including the clinicians, and CBO staff, as well as counselors. So that's an area we've taken on this year. My testimony today really focuses on that and our view. And so, so we are grateful that the mayor has increased the budget, and we support that increase, and we support the additional funds for the CBO grants to allow for operating funds to stabilize their work. But our view is a little bit more ground level, and we want to make sure that young people can actually access the services. So we are asking for 3 things. Number 1 is that we have more sharing of information. We have DBH has been working hard to train and place clinicians in the field, and we want to make sure young people can actually reach them, that they know the services they're providing. And so that's one area that I think we'd like to see as part of an infrastructure addition for this funding. We'd also like to see data collection and sharing, which we do not have in the field. And the third thing is we'd like to see additional support for Tier 1 and Tier 2 services. I think the clinicians have primarily had to focus on acute mental health and crisis issues, which is a small percent of the population, probably less than 5, but a significant percentage of young people, especially in the high schools, are depressed, suicidal, and they also need support. And so we're recommending that we invest in additional youth development-based support through a pilot initiative with DME. And thank you so much for listening to my testimony.
Thank you very much, Nadia. We appreciate your testimony, as we have over the years. And we've tried to pay heed, take heed to those things that you've testified on. And I think we've been as responsive as we possibly can up to now. You've made some additional recommendations today, and I appreciate it very much, okay?
Thank you, sir.
All right. Let's see. Anna Mabel Jones, are you there, Anna?
Yes, sir. I'm here, Councilmember Gray.
Okay, you want to go right ahead with your testimony?
Yes.
Okay.
Okay, thank you. Good afternoon, Council Chairman Gray, and members of the committee, and Dr. Bazran. My name is Anna Mabel Jones, and I'm a woman in long-term recovery. And what that means for me is I haven't picked up a drink or a drug since August the 30th, 1999. So I stand before you here today as a wife, a mother, a senior outreach coordinator for Oxford House, and a family advocate for a brother who lives in the District of Columbia, and he deals with mental health issues. Between 2006 and approximately 2018, the district government funded recovery housing through the SAMHSA Substance Abuse Prevention and Treatment SAPT block grant. However, for the last 3 years, the district has not included funding for recovery housing in their SAPT block grant application to SAMHSA. Therefore, DBH has used various funding mechanisms to support the Oxford House Recovery Housing Program, including district appropriated funds. Currently, we are being funded through the SOAR SAMHSA opioid grant, which expires in September of this year. It would be helpful for the district to have a constant funding mechanism for recovery housing. I recommend that DBH include funding for recovery housing in their annual SAPT block grant. Oxford House provides a warm, loving home for people coming out of drug and alcohol treatment centers. They have lost everything: their partner, their families, their children, their jobs, and their income. We provide a structure where recovering residents can rebuild their life, the life they've lost, and reconnect with their loved ones and community. Oxford House provides services with a heart, while at the same time being one of the most cost-effective residential programs funded by the District of Columbia. Oxford House currently has 39 homes with spaces for 330 residents. This comes to a cost of $1,742 per bed. Our services are so cost-effective compared to other residential programs, and we're peer-to-peer support. So I'm just excited to be here with you all again and share about the awesome things that Oxford House is doing, and just so excited to be a part of the growth and saving lives in the District of Columbia. So thanks for letting me share.
Absolutely. Thank you, Anna, for your testimony and your work on yourself personally, okay? You've now had an extensive period of abstinence, which I think has been obviously a major benefit to yourself, and I doubt that information, that advocacy has been shared with others as well. So thank you for all you do every day, and we will continue to do what we can to make sure that these programs are continued in the District of Columbia. So thank you, Anna, for your testimony today.
All right. Thank you so much, Chairman Gray.
Welcome. We have a number of people who I think are with PAVE. Let me make sure. Is Mary McCain, Latanya Graham, are you all with us?
Latanya Graham.
Are you there? You ready to testify, Latanya?
Yes.
Okay, go right ahead. You're on.
Thank you. Good afternoon, Councilmember Gray and members of the Committee on Health. My name is Latanya Graham. I'm a Ward 7 resident and a school bus driver for Aussie DOT. My daughter Asia attends KIPP College Prep in Ward 5. I advocate with parents, amplifying voices in education. Thank you to the mayor for your $3.8 million investment in school-based behavioral health in the FY 2023 budget. I'm testifying today because I want all kids, no matter what neighborhood they live in or what type of school they attend, charter or DCPS, to have access to mental health support. The district can do this by investing $300,000 for a cost analysis as part of a needs assessment to better understand what our kids actually need. My daughter has always been an exemplary student, making excellent grades and testing extremely high on PARCC and ANET tests. During her 8th grade year, I sought an IEP to protect her because the 504 plan I had in place for her wasn't properly carried out by the school. On the academic evaluation of the IEP, she tested on college-ready level and was referred to attend the Learning Center at KIP, which is a school geared towards social and emotional support. My daughter was diagnosed with depression in 2018. She had faced multiple traumas. Started at age 7. She was inappropriately touched by a 7-year-old boy in school. This boy also threatened to stab her, which led her to conducting a forensic interview at Safe Shores. Shortly after, she was scared to sleep alone. She would wet the bed and had dreams and so on. This was the first of a number of incidents she's experienced at school. And these were also done by the hands of little boys who had unaddressed needs. The Learning Center worked really well for her because, I apologize. The Learning Center worked really well for her because the teachers, clinicians, and staff are geared to support your child. They didn't see behavior issues during her tenure at TLC. She was respectable and engaged. They had to give her extra work because she completed her work so fast in each class. At TLC, they treat your child with genuine concern for their well-being and ensure that their social and emotional needs are met. I truly believe it takes a village, and TLC was that village. I felt at ease and confident that my daughter was in a safe, concerned, and that she was in safe and concerned and professional hands. I thank the entire TLC staff for the assurance and guarantee of meeting my daughter's needs. Now that Asia attends KCP in Ward 5, she continues to perform very well academically and get all A's and B's. My daughter isn't a troublemaker, nor is she a bad child. She's healing from past hurts. I'm testifying today because I believe that parts of the approach that makes TLC so successful should be available to all schools. Initially, I pursued an IEP for my daughter because I felt that if she had an IEP, I could protect her. Prior to the 8th grade year, she had been getting sent home from school for behavior issues a lot, and I would have to take off work or leave work early. And I wasn't, and I'm not a stay-at-home mom who can run to the school at every phone request. I couldn't keep taking off work to attend every reentry meeting every time she was sent home from school. Although an IEP has been beneficial, school needs to support the very clear goals set out, especially when it comes to school-based mental health and access to the help she needs. Invested in mental health expansion so that there would be at least one clinician available is a good start. But what families who have students like mine need is consistency, assurances, and equality in social, behavioral, mental health supports, regardless if they have an IEP or not. She does have some good people on her team at KCP. In fact, they tell me she's a rock star who's intelligent, engaged, assists other students, and helps them with their work. But how do we make sure that they're supported? It doesn't seem as if the public charter schools are able to support the behavioral health needs of kids with IEPs to the same level as DCPS schools, and that's not right. We want to see increased partnerships with community-based organizations like Mary Centers and Y Center made more available. Asia deserves to attend a school that can support our kids both academically and in terms of social, behavioral, mental health. When the school year started, she was excited and prepared to take her honors classes. Due to lack of behavior support in those honors classes, she was allowed to take one honors course, which was seminar, and the remainder of her courses were taken in the behavior support rooms located in the lower level. Because of this lack of support, my daughter felt singled out of her seminars honors class and completely withdrew from the program in mid-February.
LaTanya, can I ask you to wrap up? Your time is up. I wanted to give you some additional time as we did, but I want to make sure that we don't deprive the additional witnesses of the opportunity to testify themselves. So can you wrap up, LaTanya? I appreciate that.
Yes. Since she withdrew herself from the honors program, she's been doing very well. And students shouldn't have to choose between academics and social behavior and mental support. I'm asking you today to provide $300,000 cost study as a start to truly assessing the mental health needs of DC communities, school communities. We could do this by generating a comprehensive map of what mental health needs and supports currently exist in each school, including corresponding gap analysis. Thank you for not allowing me to testify and share what I want to see for our kids and our district. And I apologize for being emotional.
That's okay, Tanya. Listen, when you are expressing yourself to support your children, your child, there's no way that we can do anything but try to be as supportive as we possibly can. So don't apologize for being emotional about your daughter, okay? We appreciate that.
Thank
okay?
you. Thank you
All right.
so much.
You're welcome. I think Councilmember Lewis George has rejoined us. Let me see if she has any questions of you, Latanya. Okay. All right, we'll continue on. And if Councilmember Lewis George rejoins us with any questions for any of these panelists, we will be happy to hear from her.
Thank you.
Okay. I think Kalita Boyd, are you there?
Yes, Councilmember, I'm here. Good morning.
Okay, Kalita, go right ahead with your testimony, okay? We appreciate you being here.
Good afternoon, Councilmember Gray and members of the Committee of Health. My name is Kalita Boyd and I'm a Ward 8 resident, proud parent of 3 amazing children who have attended both DC public schools and charter schools. They have also graduated from the University of the District of Columbia, and I am a Ward 8 parent leader and education board member and organizing captain for PAID. I want to start by thanking the mayor on her continued investments in school-based behavioral health and FY23 budget. To support these investments of $3.8 million in the school-based behavioral health dollars, I believe that the district should fund a $300,000 cost study. The cost study will believe to be a true cost of the program now and in the future. The district should also develop a comprehensive map of what it will look like and what supports exist in each school and what's missing. Today, I'm testifying to advocate for even more support when it comes to school-based mental health for our kids. We don't only need more dollars, but we need a stronger implementation and an accountability system of those dollars. This calls for DBH and the Deputy Mayor of Education to partner to develop a clear, publicly transparent, and support accountability system so that any agency and community-based organization provide mental health supports in schools that are working together to provide kids the services they need. Mental health support encapsulates a lot. Although the comprehensive map and cost study will primarily benefit younger students, the positive effect of these investments will impact not only kids who attend K through 12, but also our UDC students. For many of these young adult students, the future seems unsure, considering the lasting effect of the pandemic on our economy and society. They need a strong foundation for resilience and tools to deal with their anxieties, which begins in their earlier years. Effectiveness of school-based mental health intervention is also at least a part determined by what is happening in students' homes, in the streets, and in our overall greater community. We need to serve the whole child, the whole family, providing the wraparound support for families. I hope that through improved implementation and accountability systems, we will be on the right path to doing so. Thank you today.
Thank you so much, one, for your testimony and also for being a supportive parent.
Thank you, Councilmember.
Oh, there is nothing more important than that. So thank you so much for doing what you've done to help your daughter get through the higher education that she's obviously done very well at. So
yes,
thank you so much.
Graduates.
So please tell her that we have expressed our and shared with you on our behalf our appreciation for what she's doing. And what a great motivation that's going to be for other children
yes.
who are her friends. and probably live near her, where she lives. So thank you for everything you do. I appreciate it.
Me too, sir. Have a beautiful day. Thank you.
You too. Okay. Councilmember Lewis George, are you back with us?
I am. My computer is possessed over here. I should have stayed home like you did instead of coming to this Wilson building. My computer keeps going out and coming in. So, but I'm still here. I am with you.
Thank you. Well, we're glad to have you. Do you have any questions you want to ask of Kalita Boyd? Okay. How about Tara Brown? Is Tara with us? Tara, are you here?
Deb, give me just a second. Councilmember Gray?
Yes.
Yes, I'm here, but I'm in a meeting with my boss. Can you put me at the end?
We'll come back, okay?
Okay, thank you.
Okay. But Taisha Andrews.
Hello, I am here. I was expecting that Tyra will be going. I'm going to get set up now.
Well, don't go too far.
I'm walking back to my desk
Okay.
to sit there.
We'll come back to you.
I'm
How's
to my
that?
desk to sit down.
Oh,
I'm
good.
sorry?
Okay. All right. We'll wait. Go ahead.
Okay.
Ready?
Well, I'm walking to my desk right now.
Okay. Well, we'll look forward to it. Okay.
Well, go to the next person and come back to me.
Okay. How's that?
Okay. Okay, that's fine.
Renee Davis. Renee, are you here?
It's not.
Okay. How about Randy Grant?
I'm here.
Yes.
You there, Randy?
Yes, I am.
Okay. I hope I got your name straight.
Yes, you did.
Okay.
Yeah, Daddy's girl got his name, but you said it correctly. Well, good afternoon, Councilman Gray and the members of the Committee on Health. As I just stated, my name is Randy Grant, and I'm here speaking out today with Parents Amplifying Voices in Education, better known as PAVE. I lived and worked in Washington, D.C. as an artist and an educator for over 30 years, 10 of which have been in Ward 7. As a mother of 2 daughters, I know firsthand the necessity for mental health services for youth and young adults. Let me just say thank you. Thank you for everyone who, in part worked so that the mayor would put in the $3.8 million investment in our school-based behavioral health. As her record investments in OST, which also helps support the social emotional learning and behavioral health needs of our students. While we welcome that initial investment, we know that is just step one in regards to student-based mental health. We need to work on the pipeline and the model infrastructure. The investments do not address what our students, parents, and providers have collectively asked for, which simply is a comprehensive map of what mental health needs and supports currently exist in each school, and funding stabilized grants to our community-based organization, clinicians, and professionals, the backbone of our programs. I think I've told my story before, but I had a daughter who is 19 years old now, but at 11, she was attacked on her way home from school. It spun into a mental health crisis in which she attempted suicide. She was committed in the Psychiatric Institute of Washington. She spent about a week and a half there. Ultimately, she wound up losing her whole high school year. So from the 8th grade to the 12th grade, she was unable to attend school, mostly because we did not have access to the resources and mental health services to support, one, her diagnosis of PTSD, agoraphobia, and generalized anxiety. It was a battle going back and forth trying to get those resources. I wasn't on Medicaid, which already had an extensive waiting list, and the pricing for the type of counseling and services that she needed was just way out of my pocket. And so it's really serious that we address at the school level access for parents with students who are dealing with issues surrounding their children's mental health. You know, if you can just think about where we are right now with the pandemic. I'm here at the Seed Washington DC school, in which we just lost a prior student to gun violence again. Prior to that, in 2018, we also had a suicide. And so I know firsthand how stress and trauma ravages students in Ward 7. And I really, really am here to continue to support us addressing our needs in a way that helps get the right services to the right people at the right time. I really appreciate you having parents here speaking to this issue along with others. It just shows that you know that parents' voices are very important, and I really, really appreciate the work that's being done thus far. Please continue to lean on us to get to the finer points of how we need to handle that. And again, I'm talking about those supporting corresponding analysis, you know, making public health to create a comprehensive and long-term plan for the future. You know, mental health isn't something you cure, but it's something you manage. And so we have to commit to that long-term practice of really, really taking a look at how in each school these things are being handled and what the needs are individually for our students. When I think about how the city can address this issue, I know the first step is generating a comprehensive map of what mental health needs and supports currently exist in each school, and getting that information in the hands of the right people who can help us utilize the money that we are putting in that direction to get us our fund and cost study to determine the trust cost of expanding the school-based mental health program now and in the future, and to support our CBOs, clinicians, and professionals. I just want to say again, I can't say enough. Thank you for allowing me to testify and share what I want to see for our kids in our city. I hope you'll take this seriously, as you have, for mental health and social emotional learning support in our schools. Thank you again, Vincent Gray and the Committee on the Health.
Thank you, Randy. Thank you so much, one, for your testimony. Thank you so much for continuing to speak up on behalf of your daughter. It means so much to every one of us who participate in these jobs and these roles and whatnot, to be able to hear from parents. You know, I'm a resident of Ward 7. I don't know if you know that. I appreciate very much your testimony and your speaking up on behalf of your daughter. There is no stronger advocacy than that of parents. And I'm a big supporter of PAVE, and will continue to be. And we'll look forward to continuing to hear from you.
Absolutely. And I thank you. I really want you to understand that it takes all of us parents, politicians, and professionals to really face this issue head on and get some real work done in our city, which is very crucial at this particular time.
Well, absolutely. Thank you, Randy, so much for your testimony. We appreciate it. And don't stop, okay? And
absolutely, I'm here.
Fantastic. Well, PAVE is an organization that I've been happy to support over the years. So keep doing that. And people like myself will continue to work hard to be a part of what you're trying to do also. So thank you, Randy, so much. And please tell your daughter that we appreciate her mom doing what she does to speak out on her behalf, and how important we know that is for the work that we're trying to do, okay?
Absolutely. No, we have your back. So call on us when you need it. You know, my mouth is always ready to share the story.
Thank you so much. I appreciate it, Randy. We have, I think we have some of our folks back with us at this stage. Is it Tara Brown? So how
Yes,
about
yes. I'm here. My meeting's over. Thank you for working with me.
yeah, okay. Well, you ready?
Yes, sir.
Go right ahead.
All right. Hello, Councilmember Gray, the Committee on Health,
How are you?
HBX, and DBH. My name is Tara Brown. I'm a Ward 8 resident and a PAVE parent. My child suffers from severe clinical depression and extreme social anxiety. Their mental health issues are treated with therapy and medication. Their ability to learn was significantly impaired by their condition. Once they received their diagnosis, it was even more important to understand the impact of their mental health on their learning process. We did a needs assessment and then tailored their education to fit their mental health needs. Now they are managing both their mental health and their education better. We have over 94,000 more students that need the same assessments and customized plans for aligning their mental health needs with their education. Today I'm talking about trauma and learning. There's plenty of research compiled about what trauma does to the brain, especially developing brains, and how that stress and trauma can impede the learning process. I do not have to convince this group that there is a need for school-based mental health. Considering that this pandemic is a collective traumatic experience, it is logical to assume that virtually every school-age child in DC has gone through trauma. When you also factor in violence, abuse, poverty, and the unmet mental needs of some caregivers, this assumption has even more credibility. Considering how adults have struggled with COVID, how does a child process it while simultaneously getting an education that is integral to their lifelong success and develop into a fully functioning adult? DBH is integral to the success of our students operating under a cloud of trauma, and this trauma existed before COVID and will continue beyond COVID. School-based mental health will always be foundational to the education of our students. However, before you can determine where a student falls on the multi-tiered system of support, you must understand what each school community needs to support their students. The first step towards addressing the problem is understanding it. Our PAVE parent priorities around school-based mental health include assessing the mental health needs of each school, generating a gap analysis to determine what is needed compared to what each school has, using this gap analysis to create a comprehensive and transparent plan for the future, inclusive of families, and investing, you know it, $300,000 to fund a cost study to determine the true cost of expanding the school-based mental health program now and into the future. On behalf of the PAVE parents who were surveyed and collaborated to come up with our parent priorities around school-based mental health, I urge you to listen to our recommendations, figure out what you are doing, figure out what needs to be done, then work together to make it happen. DC invests billions in education. It is a colossal waste of money if we don't also invest in enough school-based mental health supports that will ensure our children are equipped to benefit from that investment and can actually learn. Thank you very much.
Second. So you, Taisha, that just texted us? Well, I'm sure at this stage, if necessary, we'll come back to you. Who's that?
This is Taisha.
Taisha. Oh, hi, Taisha. How are
And
you?
I'm well, thank you. How are you? That was Tara Brown that just finished up.
Okay. And she did a good job. How about you, Taisha?
Thank you. Thank you, Taisha.
You're welcome, Tara. I'm ready.
Clark. Page scarf on. Is that your page scarf?
Okay. Oh, yes. Can you see it? I wasn't sure if you could see it or not. I couldn't wear my.
I can see it. I can see it.
Yeah, I'm working in the office today.
When I get back there.
Page shirt.
Ready?
Yep, I'm ready.
Go right ahead.
All right, well, good afternoon now, Councilmember Gray and the members of the Committee on Health. My name is Taisha Andrews, and I'm a Ward 8 resident and proud parent of a kindergartner at Plummer Elementary School and a 7th grader at Jefferson Middle Academy. I'm also a Ward 8 PLE board member for PAVE. I'm testifying today to advocate for school-based mental health program funding. My advocacy for school-based mental health program supports stems from my own personal experience. Growing up, I felt high levels stress and anxiousness, especially when I was in the classroom. Despite these feelings being so visually apparent, my family, teachers, and schools did nothing to help. This is why I fight for kids in the district as a PAVE parent leader. I want all of our kids to receive the mental health support that I never did. My advocacy only grew stronger following my oldest son's high-functioning autism diagnosis. When he was first diagnosed, specialists explained that he was reaching all his developmental milestones, but aspects of his behavior needed to be addressed with the help of mental health professionals. Approximately 7 years later, I was told yet again that my second son also was a high-functioning autistic. While I am fortunate that my husband and I are working alongside both my son's teachers and school staff to manage their behaviors, the resources are limited. Mental health supports come in a wide variety of ways, and all children's mental health issues are different, which means their reactions to similar situations will be different as well. There are children that have lost parents and guardians due to COVID. Black and brown people in general have higher stressors due to our current situation in the US, and in addition to other mentally, I would say, how do I say it? Mental things that have passed down through history and genetics and slavery. And those two things are separate mental health issues within themselves. In addition, some children are with mental health issues are looked at as troublemakers instead of children that need extra help. Now, as of now, both of my children's schools do not have enough mental health clinicians or support to meet my children's needs, and my sons are two of many students in their respective schools with a learning disability and IEP. The school-based mental health supports my sons need are way beyond that of many of us that our schools can provide. This is why we need a change. One of the solutions to this is that PAVE parents identified creating and distributing a citywide needs assessment that will help determine the mental health needs and supports currently exist in each school and what needs to be met. The design and implementation of this assessment, of course, must include the voices and supports of parents and families. A needs assessment will help us learn directly from those whose voices are lost or ignored in discussions about school-based mental health support. Additionally, to support the future of the program, we are asking for at least $300,000 for the cost to study to determine the true cost of the program and in the future. That is most important. In addition, we need $2.4 million for grants for CBO providers with for a total of $3.8 million in additional funding. This past Saturday at the PAVE budget forum, we learned that $18 million has been secured for DC schools for the next 2 fiscal years. However, this funding is to be split evenly amongst the DC public and DC charter schools. This is unreasonable due to the fact that charter schools also receive private funding. DC public schools need the funding for more and better resources to compete with DC charter schools. Our funding levels are not addressing the impacts of the pandemic and our children's outside mental health needs. We need to support our clinicians, the backbone of this program, and ensure we are funding their important work well. Wrapping up, from the results of our 2021 fall back to school survey, I learned that 55% of parents with students that have IFPs are not satisfied with the mental health and social emotional supports they receive at school. I haven't seen many other surveys that ask about my son's IEPs with them receiving school-based mental health support. This is why an assessment created with parents' input, just as we did in the PAVE survey, can ensure this representation is top of mind. I want to know all the answers instead of wondering how I can provide my children with school-based mental health support. This means knowing where I can find these supports in every school, being able to name who is providing these supports, and determining what supports will best serve them both. Parent leaders are ready to move forward and take steps towards real change. To our district leaders, I'm here to tell you that our hands are out and in this budget season and the next. Prioritize our solutions and take that step with us. Thank you for allowing me to share my vision for students and families in our district.
Thank you, Taisha, for your testimony, and thank you for being, you and your husband, being great advocates for your son, okay? And I know he will appreciate now and in the future great support that you and your husband have provided, okay? So let me say thank you to you.
Thank you.
Yeah, okay, I've been a big supporter of PAVE. And I've often attended the meetings that you all conduct, and we'll be there to be as supportive as we possibly can, okay? So thank you again, Taisha, for your testimony.
Thank you again.
Welcome. And Tara Brown, thank you for your testimony also. We appreciate it. So
Yes, sir.
keep working with PAVE. It's a great organization. We appreciate it, and we'll look forward to continuing to work with you, okay?
Thank you.
Yes, thank you.
Look forward to it.
Okay. I think we have, that's the list of folks, additional folks who wanted to testify from the public. And let me see if some of my colleagues are here. Is Councilmember Henderson, are you here?
I'm here, Mr. Chairman. I don't have any additional questions for that panel. I just wanted to say I was listening even though I was off camera, and I just wanted them to know that I did hear their testimony and appreciate their sharing their personal perspectives around school-based mental health and just the need for additional services and supports across the board.
Thank you for your testimony and your support, Councilmember Henderson, along with you and Councilmember Lewis George also. Who was here a little bit earlier. So I want to thank both of you for being a part of the conversation today and the advocacy for the services that have been advocated today. So thank you so much. I appreciate it very much, Councilmember Henderson. Councilmember Lewis George, we know you're probably listening, but because you probably are moving back and forth between hearings, but in any event, I want to thank you for your engagement today. So thank you, Councilmember Henderson, Councilmember Lewis George, so much for your testimony. And Councilmember from Ward 2 was here a little earlier too. So I am delighted to have such engagement from our colleagues across the council. So I appreciate it very much. Thank you all very much, and I don't think we have any other members who are here at this point. At the same time, we're going to have Dr. Bazran to come forward shortly. Let's take a brief break as we've done before, and try to prepare ourselves for your testimony, Dr. Bazran. So,
thank you, sir.
Okay, thank you. We'll be back in, let's say, less than 10 minutes, okay?
Dr. Bazran, are you still here?
Yes, I am.
Okay, we are having some slight IT issues, and you have somehow been made host. So if you would give me some assistance here, if you will look at the participants tab, and
if it's okay with you, I'm going to have Marina Soto from my staff, who's really in with this, work with you. Okay.
Okay, that's perfect. Thank you. Appreciate it.
Hi, Michelle. I'm here.
Hi. Okay.
Hi.
So do you see the participants tab?
Yes.
Okay, so if you go under the participants tab, you'll see staff Michelle Loggins.
Yes.
Okay, I need you to right click on that.
Okay, make you a host.
Yes, please. Thank you.
Got it.
All right. I am now the host, and I will promote you next.
Okay. Thank you.
Thank you very much.
No problem.
Okay, Marina, I've just made you a presenter. So you have those privileges, so you'll be able to share your screen as Dr. Bazran speaks.
Thank you, Michelle.
You're welcome. Thank you. You might want to test it out while we're on break.
Okay.
Can you tell Michelle?
Michelle, there'll be others that we need to promote.
Sure, just drop their names in the chat and I'll do that.
Okay. All right. Thank you.
Okay. Sir, are you ready to get started again? Oh, wait a minute, you're muted. Okay. Are you ready to get started again, sir?
Yes.
Oh, okay. Let me alert Dr. Bazron and the other offices.
Okay.
Right, sir, we've been rejoined by Dr. Bazron.
Okay, great. Dr. Bazran, how are you?
Fine day. Good afternoon, Chair.
Well, we're glad to have you, Dr. Bazran. Thank you so much. I guess I would say that it's been 3+ years since you've been back. Is that right?
Not quite 3. Next month.
Next month, it'll be 3+ years then, huh?
3, every 3 years.
Well, of course, continue to welcome you back. How's that?
Thank you.
And we're glad to have you and glad to work with you in our continuing efforts around mental health in the District of Columbia. You've heard all the testimony because you've been here the entire time, but you heard so much of the testimony, especially around school-based mental health services. I don't know if you're intending to address that in your testimony. It obviously is a huge issue in the District of Columbia and continues to be and will be. But I appreciate the work that the mayor and you have done to help, and the council, my colleagues, to be able to address these issues forthrightly in the District of Columbia. So there'll be an opportunity, obviously, in this testimony today for you to be able to address those issues. So we're ready for your testimony when you are.
Okay. Thank you, Chairperson Gray, council members, and council staff. I'm Dr. Barbara J. Bazran, Director of the Department of Behavioral Health. I am pleased to testify before you today on Mayor Muriel Bowser's proposed fiscal year 2023 budget and financial plan. Mayor Bowser's proposed FY23 budget invests in building safer and stronger communities and in helping us emerge from the pandemic stronger and more ready to thrive than ever before. Under the mayor's leadership, DBH supports these goals with a range of prevention, treatment, and recovery services and supports that improve the health of individuals and the social and emotional well-being of our community. Like people across the country, the mental health of district residents has been impacted by the grief, loss, and physical isolation of the last 2 years. In a national survey, 2 out of 5 adults report symptoms of anxiety or depression. The U.S. Surgeon General issued an advisory to highlight the urgent need to address the impact of the pandemic on youth and their families. Studies show that people often turn to alcohol, opioids, and other drugs to help them cope with the pandemic. For people already facing mental illness, opioid addiction, or other substance use disorders, pandemic-related disruption in treatment regimens, social networks, and daily routines challenge their recovery. Gun violence and safety concerns place additional stress for too many in our community. Long-standing health disparities across populations were exacerbated by COVID-19, with people of color disproportionately affected by severe illness, death, and associated economic loss. Mayor Bowser's proposed FY23 budget for DBH ensures that residents can get connected to the care they need by phone, at home, in school, or in the community. The FY23 budget supports the work underway with the Department of Healthcare Finance to integrate behavioral health services into the Medicaid Managed Care Program effective October 1 of 2023. Whole person care recognizes that physical, behavioral, and social health are interdependent and must be treated together to achieve optimal health. Bringing these services into the managed care program supports better care coordination and alleviates the need for residents to navigate multiple systems. The promise of integrated care is healthier people living longer and more fulfilling lives. The principles guiding our transformation efforts are reflected on the slide. They emphasize quality of care, care coordination, and the movement to whole person care. The integration to managed care provides the opportunity for DBH to embrace its role as the behavioral health state authority and transform behavioral health in the district to be more holistic and equitable. DBH's role as a state authority includes establishing district-wide standards and policies for behavioral health care service delivery, monitoring quality of care, promoting behavioral health education and disease prevention, and defining and measuring population health outcomes. Let's take a moment to recall how far we've come in building a behavioral health system that residents need and deserve. Just 10 years ago, the district ended 37 years of federal oversight of our public mental health system during your administration, Chair Gray. A year later, the Department of Behavioral Health was established to bring together treatment and services for residents with mental health and substance use disorders to promote better health, prevent behavioral health problems, and support better outcomes for individuals with co-occurring mental health and substance use disorders. Today, the integration of behavioral health and primary care moves us to whole person health care. To prepare providers for this transition, DBH and the Department of Healthcare Finance are engaged in planning and readiness activities with providers to ensure the smooth transition of behavioral health services to managed care. We are surveying providers to identify their needs, providing multiple technical assistance opportunities, and providing grants to support IT development. We are conducting a rate study to determine the appropriate payment for behavioral health services. As we move towards whole person health care, DBH works to provide high quality care for residents who rely on public behavioral health care system, as well as for residents who may be experiencing common disorders such as depression and anxiety related to the pandemic. In FY21, the utilization of mental health services increased by 14%, while the number of residents receiving substance use disorder services was essentially the same. The accelerated use of telehealth allowed for continuity of care as well as more frequent consumer engagements. Data from the first quarter of FY22 indicate that services are being delivered in a hybrid environment of in-person and telehealth based on consumer preference. The proposed FY23 budget anticipates that increased service utilization and increased use of telehealth will continue. DBH has certified a robust number of providers across the district with particular attention to locations in Ward 7 and 8. However, research shows that less than half the people with mental health conditions receive treatment. Too often, people are misunderstood, blamed, or are embarrassed to get the help they need. We want to make it easier for people to get the care they need as soon as possible when they want it. We partner with faith leaders, advisory neighborhood commissioners, behavioral health advocates, civic leaders, and a range of community organizations to spread the word that effective treatment is available and to combat stigma and stereotypes that often prevent people from seeking help. We work to ensure that language is not a barrier to care. We actively recruit bilingual staff, making available language and sign language interpretation, and translate outreach materials into 5 different languages. DBH certified providers are also required to provide interpretation services. Under the direction of Deputy Mayor Wayne Turnage, DBH works with agencies within the Health and Human Services cluster and throughout government to integrate the work they are doing to support residents with behavioral health needs. DBH has partnerships with the Office of the Deputy Mayor for Planning and Economic Development, the Department of Human Services, the Department of Employment Services, and the Department of Corrections to co-locate staff to normalize behavioral health treatment as a resource, just like housing or a job to support daily living. We know that residents need varying levels of mental health and emotional support. The proposed FY23 budget includes a 24-hour mental health hotline for people who may just need to talk or want help with problem solving and self-care techniques. Any resident can talk with a clinician for up to 3 sessions with no enrollment papers to fill out and no cost sharing. The proposed FY23 budget includes funds to promote broadly the availability of the supports for all district residents and to target communities most at risk of behavioral health challenges. The proposed budget includes $250,000 to fund prevention of opioid use disorders in the LGBTQ community. DBH also supports residents to access behavioral health care through their insurance coverage. By law, insurance companies generally must offer behavioral health benefits at the same level of support as physical health care benefits. DBH supports the work of the Health Benefits Exchange Authority and the DC Health Links to promote healthcare parity. Through grant partnerships with the Wentz Center and Howard University, we have continued to provide support for frontline health workers, including our own employees, through promoting self-care and encouraging seeking help. About 70% of DBH employees continue to report on-site during the pandemic. I can't express my appreciation often enough, so I want to take this opportunity to thank them again. They were there when we needed them most and still remain there. I will now discuss in more detail various aspects of the proposed FY23 budget for DBH. The proposed FY23 gross budget is $369,419,870 which is a 3.7% increase over the FY22 approved budget. The increase includes a $10.7 million increase in local funds and a $16 million increase in federal funds. The proposed FY23 capital budget is $12.7 million for information technology equipment upgrades and St. Elizabeth Hospital facilities projects. The largest source of money is the local budget of $298 million, a 3.7% increase over the FY22 budget. The second largest source of funds is $55 million in federal grants, which includes funds through the Federal American Rescue Plan Act and the State Opioid Response Grant. DBH is anchored by 8 administrations, including St. Elizabeth's Hospital, which together oversee, manage, and deliver behavioral health care services and supports to district residents and establish the policy and regulatory framework for behavioral health care for the District of Columbia. The proposed FY22 budget by administration shows that 57% of our budget supports community-based services either operated by DBH or delivered by the Certified Provider Network. St. Elizabeth's Hospital is supported by 29% of the budget. The mayor's proposed FY23 budget for DBH funds a projected increase in utilization of services, continues investments that support our most vulnerable residents, and enhances early intervention services and school-based supports for children and their families. The proposed budget also includes $1 million for facility maintenance at St. Elizabeth's Hospital, which is now a 12-year-old facility. The proposed budget includes the following: $36.5 million for mental health services, which leverages $121.7 million in services. $28.4 million to maintain supported housing for 1,700 residents. $41 million for substance use disorder services. $10.9 million for mental health services for uninsured residents. $33.6 million to expand school-based services. $18.3 million for crisis services. $7.3 million for prevention and early intervention services, and $104.4 million to support St. Elizabeth's Hospital. The proposed budget realizes $2.6 million in savings through maximizing the use of Medicaid for crisis services, aligning the supported housing model to expand capacity and maintain clinical support, and contract efficiencies. The proposed budget supports new and existing priority services. This includes $8.9 million to support behavioral health transformation services and increase utilization by Medicaid eligible residents. $3.7 million to expand school-based services. $2.5 million for the Sobering and Stabilization Center. $250,000 to prevent opioid abuse in the LGBTQ community, and $213,000 to support health promotion and public engagement. I've already talked about most of these initiatives, so I'll focus on expanding school-based behavioral health services. Children and young people have been particularly impacted by the pandemic, as disruption in routines and relationships have led to increases in social isolation, anxiety, and learning loss. Some research shows that youth who have been exposed to multiple traumas, have a history of anxiety of issues, or have experienced family adversity face a much higher risk of prolonged stress. As the Surgeon General's advisory notes, before the pandemic, an alarming number of young people struggled with feelings of helplessness, depression, and thoughts of suicide. And rates have increased over the past decade. Further, in one study, more than half the parents expressed concern over their children's mental well-being. Studies show that all lifetime mental health disorders start by the age of 14, and school-based services have proven to be an effective, safe environment to reach students who need mental health supports and their families. Our goal is to support the conditions of learning that have been shown by the research to be linked to students' academic success, graduation, and post-secondary success. The results of this strategy may continue to decrease the learning gap between Black and white students. Through multiple year investments by Mayor Bowser and the council, the proposed FY23 budget funds a clinician in every public school. Behavioral health clinicians from DBH or contracted community-based organizations are now in 158 or 63% of the public schools. And we continue to expand in partnership with DCPS and DC Public Charter School Board. In addition to a clinician in every school, the proposed budget includes $1,758,341 to add clinicians in the 25 schools with the most significant needs. DBH will collaborate with our education partners to select these schools. To support treatment, the proposed budget will allocate $829,000 to provide high fidelity wrap around services in 6 schools. This service will be available to a total of 120 children and their families. Care coordinators will work closely with students and their families to remove barriers to learning, access needed behavioral health services, and support academic abilities to improve overall functioning. Like many fast-growing programs, the school-based program experiences challenges related to maintaining fidelity to the model, reporting quality data, supporting the workforce, and infusing youth and family voice. To help address these challenges, the proposed budget includes $907,978 for 8 positions to work with CBOs to provide technical assistance, assist with data reporting and collection, and support fiscal monitoring and program integrity and accountability. Using a public health model, school-based clinicians are expected to provide prevention, intervention, and treatment services. Along with funding supervisors, DBH provides $53,667 for each clinician to support the delivery of non-reimbursable services. The pandemic created unique challenges to reaching students, so we provided an additional $9,316 for each clinician in FY21 and another $7,461 in FY22. Working through the coordinating council, we are examining closely the conditions in each school to identify any barriers to providing services, and the community of practice will focus individualized training and support to address these issues. We also are ready to re-examine the service delivery model and will conduct a rate study to determine if the current funding is sufficient to support the program. The completion of our expansion to all public schools will require recruiting and retaining a significant number of licensed clinicians during the current national shortage of licensed clinicians. In fact, we are competing within DBH as we are also recruiting clinicians for our community response team and other clinical services. We recognize that recruiting more than 100 licensed clinicians is a challenge that will require focused effort, careful planning, and coordination with our CBOs who contract with DBH to deliver services in our schools. I am encouraged by our ability to meet this challenge since funding has been allocated in the mayor's budget to support our workforce development initiatives to attract and retain licensed clinicians. This includes the following: full funding for supervisors. The proposed budget includes $100,000 to support supervisors at a ratio of 1 supervisor for 6 clinicians. In addition to providing appropriate guidance, this strategy aims to attract graduate social workers who can obtain the supervised hours required to advance to independent licensure. DBH has a multi-year affiliation agreement with Howard University, the Catholic University of America, and the University of Maryland to host graduate level interns to provide a pipeline of qualified staff to support the program. DBH is now working to finalize agreements with Delaware State and Morgan State University. The proposed budget allocates $281,000 to support the cost of licensure, which can be burdensome to graduates. The funds will provide $1,000 for each CBO clinician and $500 for DBH clinicians who are already independently licensed clinicians. In addition, DBH is collaborating with DC Health to connect our CBO partners to the health professions loan repayment program. DBH is committed to addressing health equity for all district residents in need of behavioral health care. Health equity is achieved when every person has the opportunity to attain his or her full health potential and is not prevented from achieving this potential because of race, social position, or other social determinants of health. The mayor's FY23 budget provides resources for DBH to advance health equity as follows: making substance use treatment easily accessible through the new Sobering and Stabilization Center. Our proposed budget includes $2.2 million to continue operating the Sobering and Stabilization Center, expected to open this summer. The Sobering Center is an important addition to our healthcare system to support individuals under the influence of alcohol or drugs who require stabilization services and support, but do not need to be transported to a hospital emergency department. Buprenorphine induction will be offered to survivors of an opioid overdose. Peers also will remain engaged with them after they leave the Sobering Center to encourage care. We will increase the number of community response team members to increase engagement of residents with behavioral health needs, connect them to care, and to address immediate crises. We will ensure that residents receive the right services from the right provider at the right time by working in collaboration with the Office of Unified Communications to respond to certain 911 calls to support individuals experiencing a behavioral health crisis. We will offer behavioral health services to children and youth through the school-based behavioral health program to address emotional or behavioral concerns that can negatively impact learning. We will expand the number of individuals with lived experience who can provide engagement and support to those facing addiction and serious mental health issues. We will provide housing to returning citizens from incarceration for up to 12 months and offer supported employment to assist residents with mental health and/or substance use disorders to get and keep a job. The proposed FY23 budget supports strong consumer voice and the presence throughout our system of care. We know that peer support is effective in engaging individuals in treatment and helping them maintain recovery. Peer leaders model our conviction that treatment works and sustained recovery is possible for everyone. Further, peer leadership is essential to our fight to reduce stigma that can prevent people from getting the help they need. DBH has strong partnerships with consumer leaders, family-run organizations, and advocates, along with the Behavioral Health Planning Council, who advises me on policy and strategic direction. Peer specialists now work in the provider network as integral members of treatment teams in community hospital emergency departments, our emergency facility, and St. Elizabeth's Hospital. DBH is working to adopt a national peer certification program to standardize training and incentivize hiring of peers in the workforce. Mayor Bowser's FY23 budget provides new and ongoing investments that support full person care and the opportunity for all residents to live longer and healthier lives. Mr. Gray, this concludes my testimony. We appreciate our partnership and the work of the committee and look forward to our continued work together. I am ready with my team, which includes Michael Neff, our Chief Operating Officer, and George Jeter, our Chief Financial Officer, to answer any questions. Thank you.
Thank you, Dr. Bazran. Thank you for your presentation. You know, it's interesting. When you returned almost 3 years ago,
Almost 3 years ago, yes.
We were delighted to have you come back to the city. With you having been here before, we knew of your talent and your commitment, and that's what we've seen in the period since you returned. You and I have had innumerable discussions about being able to realize a DBH, model of care. And I really would like to hear from you before I get to some of the additional questions, but I really would like to hear from you how you feel like, how do you feel about having been able to effectuate the model that we've talked about, you envisioned when you came back to be the director
of DBH. I've been delighted to be able to work with you. So I'll say that up front. And I just want to hear from you on how you feel, what progress are we making to be able to effectuate the vision that we've talked about on so many occasions for the Department of Behavioral Health.
Yeah, thank you, Mr. Chair, for that question. As you know, DBH is really transforming its model so that we are a true state authority. And we're working in close partnership with DHCF to move in that direction. And I think we're making great progress in that regard. It means, for example, the movement towards including behavioral health services, carving them into the managed care organization. And we are working very diligently to prepare our providers for that transformation and transition, as well as working with DBH, all of our advocates, as well as most importantly, the people who we serve. That has been, a major, I think, achievement. As you know, we have also, as a part of our 1115 waiver, able to get increased Medicaid reimbursement for a variety of both mental health as well as substance use services, including a wide portfolio of crisis services, which is extremely important for us. It's really, this whole redesign has been hard work, but I think working in close partnership with our provider community as well as DHCF, we are moving in the right direction. It is a multi-year plan, and I'm really delighted to be sitting in this chair as we move through this redesign process.
Well, we've been delighted to be able to work with you over the last nearly 3 years to be able to get to this point. We realized, when I was the mayor, you were working at you were working at the then to be DBH, and we appreciated when you came back, and I've certainly appreciated the work with you up to this point. So I want to ask some few questions around the budget. I know some of my colleagues will have some of the same concerns as well. I hate to call them concerns because I really feel like in the last nearly 3 years, we've been moving in the right direction in terms of effectuating, in terms of realizing the model that we envisioned in the first place around the Department of Behavioral Health. Because at one point it was homeless services and other services. It was I guess SAMHSA. The entity was that preceded what was DBH, and what's now being realized is what we looked towards in the very beginning. So Dr. Basran, I really appreciate that, and I have some questions, of course, that I want to ask, and some of my colleagues will as well. Can you, and some of this will be, I won't say redundant, but some of it will be allowing you to underscore some of the points that you've made already. We have what I think is a general increase for, I think, $13 million, which may not be the exact number. You can clarify that if you wish, but that's the spending increase that we saw overall in the budget for DBH. So can you clarify for our purposes exactly how those dollars will be spent in the mayor's budget?
Yes, certainly. First of all, we have 8.9 million that will support our transformation. And that is really money to pay for the increase in claims and services, Medicaid eligible claims and services. And so that's the biggest bucket. We also have 3.7 million to expand school-based services and high fidelity wraparound services and support workforce development. And I will break those services down for you in just a moment. We have 2.5, and I'm so excited about this, for the Sobering and Stabilization Center, which we have been planning, as you know, and we hope to launch this summer. And that is a low barrier way of people getting into care. We know that this will actually prevent individuals from having to be taken to emergency rooms. This will get them to an appropriate care, an appropriate place where they can sober, where our peer specialists will be able to speak to them about getting into care, and will be able to follow them over time. And we know that people may make multiple trips to this low barrier entry into the system of care, because we know that change, it takes time for that engagement. But we think that there's great promise with that. The other thing, our hospital now is 12 years old, believe it or not, in Elizabeth's Hospital. I know, yeah, you might remember the groundbreaking there. And we have added $1 million in facility maintenance. We must maintain the hospital. And so that's a part of our new our new priority. The other thing, we know that specific populations of focus have really experienced greater increases in terms of opioid abuse. And so we have $250,000 that has been set aside to prevent opioid abuse among the LGBTQ community. And then in addition, we have 213,000 to support health promotion and public engagement. And this to me is really important. What I've heard over and over and over again from advocates, from others in the community, is you have a lot of services, but we don't know about them. And so this health promotion and public engagement will do two things. It will encourage people to get the services they need. It will reduce stigma and will allow for additional communication staff to help support that effort. The other thing that I wanted to share with you is that the 3.7 million that it has been placed in the budget to expand our school-based services includes some really, for me, exciting efforts. One, we have 2.4 million in there to expand our services to 25 additional schools. Now, we know that we have also heard from the advocates that there's certain schools who may need more than one school-based behavioral health clinician.
Correct.
We now have money to identify at least 25 schools, the top 25 schools, and provide an additional clinician in those schools to begin to address that level of need. And we will work very closely with our partners from OSSI, from the public schools, the public charter schools, to identify those 25 schools. We also have money in our budget for additional wraparound services and supports in our school. We know, and you may remember several years ago, we had school-based high fidelity wraparound in high needs middle school program, and it was very effective in keeping young people in community, in family, using that high fidelity wraparound model. We are going to use this model again to provide the services within our schools. And I think that this is critically important that we have this level of services in our schools. We will be choosing 6 schools. We will be providing 60 slots. And then we out of local, and then we will for a total amount of 120 young people and their families to be served. Part will be with local money and part will be with federal money to address that need. We also, and I'm pretty excited about this piece, and that is that we will be expanding our support services within our schools. We know that now we have 251 schools, infrastructure to support that number of schools. And so we have put money in the budget to support building the infrastructure within our school system. And so we will be getting some additional staff to do some of the things that people talked about before. They talked about, oversight, monitoring quality of care, making sure that the models are offered to fidelity. And so we will then have some funding to, in fact, do that. The other thing that we will be doing in terms of our support is we will be addressing our workforce development issues. This is a serious issue all across the country. We know that we need more licensed clinicians in our schools. As I said in my testimony, to get the number of clinicians we need, we know will be a task, but we do have a plan for addressing that. A part of it is to, in addition to the supervision that we have, we're providing money for a supervisor at a 1-to-6 ratio for our CBOs to provide supervision for licensed graduates so that they can get the hours they need, so that they can then become licensed independent social workers. And we hope they'll remain right within our schools. But in addition to that, we're developing we have developed affiliation agreements with several of our universities to support internship programs. And this is to build that pipeline so that we build a pipeline of qualified people who can then join our program and support our school-based behavioral health efforts. The other thing we know is that licensure is costly. And so we are allotting $1,000 per clinician to help pay for the cost of licensure. So we hope that that will also be another carrot to help people join our team. And also $500 will be allotted per licensed clinicians so that they can get their CEUs that are required to continue to retain their licenses. So, and then the other thing I do want to mention is that we also have funding for our community of practice. And this will allow for the community of practice to continue to provide information on evidence-based practices and best practices to the full array of our staff that are working within our school-based behavioral health program. And so I'm very excited about some of these things.
That's really good. That's really good news to be able to hear, and helps us further as we speak about this to help understand how this is being effectuated. The development of the model we've talked about now for several years, Dr. Bazran.
Yes.
I want to ask you another question because I've gone way over my time on this round. So I'm going to come back I got a question I want to ask you now, and then I'll come back to other questions as we move further into this. But you talked about the sobering center. Can you tell me, at this point, can you talk about where that's going to be located, especially recognizing that there's some areas like where I live, where the problems like this are quite pronounced. And so I want to know, how we'll be able to use the sobering center in a way that will serve the entire city.
Right. And thank you for that question. First of all, the final location of the sobering center has not been determined. However, regardless of where you are in the city, you will be able to get the services and supports you need. We have a mobile van that circulates throughout the city that will be able to do a couple of things. It'll be able to assess individuals in need of help. It'll be able to get them inducted with buprenorphine. It will also be to physically, people will also be able to be physically taken to a provider location. So we do have that also available. The other thing to note is our community response team, as you know, circulates throughout the city. And when they see individuals who are in need, they can also help them and get them transported to the sobering center or another appropriate facility. And so even though it may be located in one place geographically, the services will be available throughout the city.
Okay. I hope that you will provide to us, as soon as it's available, critical information that I can share with my colleagues, especially on the health committee and other council members who will be interested in this, especially. So let's work on making sure we have that information available to me and my colleagues as quickly as we possibly can, Dr. Vazron. I want to turn to Councilmember Henderson now, who has been patiently waiting. And I want to thank her also because she has an acute interest in the issues that we're talking about. Councilmember Henderson, you're up.
Thank you, Chairperson Gray. Good afternoon, Dr. Vazron.
Good afternoon.
Okay, I wanted to just pick up a little bit where Councilmember Gray left off about the sobering center. Did I hear you earlier say that the plan was to open it this summer?
Yes.
But you haven't determined the location yet?
No, we have not determined the location, but there are lots of things that are being done. The protocols, for example, have been developed in partnership with FEMS. We have, the RFP for a provider is underway and so forth.
Okay, I was sort of thinking around like, I imagine then we would be picking a space that wouldn't require a lot of build out in terms of physical space, et cetera.
Correct.
Okay. Great. So let me ask you some questions about the school-based mental health program really quickly. And I know Oversight is how many schools currently have vacant positions?
Okay, currently, as I was saying earlier, right now, there are currently 158 schools that have clinicians physically in them, which is 63% of the 251 schools. But one of the things I do want to share with you is that you should also note that if a clinician is not in the school and that school has been paired with the CBO, the supervisors are responsible for ensuring that services are delivered to those students.
Well, I guess where I was kind of going with this is I'm just trying to understand if we have approximately 37% of the schools who don't have a person yet, the decision to then invest this additional money for 25 schools to get another person. So I'm curious in terms of how you all are having this conversation with, I guess, both DCPS and the Public Charter School Board of who gets an extra person before a school who has no one gets someone. Does that make sense?
No, I understand that. And I think that one of the things to think about is that we have heard loudly from the advocates that some of the existing schools where they're just across the city have higher need. And some of those schools have places where youth may be waiting for a specific service. And so how do we begin to address it? And I think you actually or may have talked about that with me at one time before.
Yes.
And so how are we going to address it? And so this is an attempt to address that need in FY23. Right now, we're focused on getting the clinicians we need in the 251 schools right now. And then during FY23, then looking at where there is additional need for those additional 25 schools. And we will be working, as I said, with all of our education partners and our school-based council in terms of what the rubric is for addressing need.
Okay. Okay. So let's say October. Is it possible that we would have a school who hasn't been matched yet, but another school who would have 2 clinicians in place?
I guess it's possible. That's not,
Okay.
it's not our plan. It's
Okay.
possible,
Okay.
and that's not our plan.
Okay. You mentioned earlier, and I think we talked about this during performance oversight, that you guys are embarking on a rate study.
That's correct.
Will that also include looking at the grants for the CBO clinicians in the school-based mental health program as well?
That's exactly what is there. First of all, we are working on rate study on a number of fronts. And so let me take a moment to just talk about it. One is to look at the rates related to behavioral health care services, all of our rates. And we're doing that in partnership with DHCF. Are the rates appropriate? In addition to that, we are looking at our school-based behavioral health program, the services supports that they are required to provide, and is the current rate appropriate for that population? As you know, right now, the current formula is we provide $53,667 per clinician plus $16,666 for a 1-to-6 ratio of supervisors. And so is that sufficient? Not sufficient? What should it be? So that's where we are right now.
Okay. I noticed in the budget book and data that we received that specifically for school-based mental health, there was a reduction of around $557,000 for contractual services.
Oh, for school-based behavioral health? No. You mean for children's services? Oh.
Nope, school-based.
There's been no reduction in school-based.
Okay. Okay. Well, we'll circle back with the committee on that.
Okay.
The books sometimes can be wrong, what is provided to us. Okay. Well, okay, I will move on from there. I know, we have this ongoing conversation around providers and things like that. For DBH as a whole, in CSG 50, it's subsidies and transfers. There's a title called Maintenance of Persons that has $10.3 million budgeted for both FY22 and FY23.
Okay.
I'm curious. We're trying to understand, what does maintenance of persons mean?
Okay. Mr. Neck?
Thank you, Dr. Basra, Chairman Gray, council members and staff. Maintenance of persons. Can you still?
No, somebody one of you just has to unmute, not both of you.
I'll take on. Okay, good.
I'm going to mute Dr. Basman so you can speak, Mr. Knapp.
Thank you. Okay, great, thank you. Fund 50 type maintenance of persons is generally used for our services that are provided directly to consumers. So generally mental health rehabilitation services, substance use disorder treatment or treatment of persons. And we would use that also for certain grant programs, school-based programs.
Okay, so here's my question. So because it's about $10.3 million for both FY22 and FY23. But in the expenditure data dump that we've received from the budget office and the CFO, it's showing that zero has been spent so far in FY22. So that's why I was curious, like, what does this mean?
That's probably Medicaid. Yeah, would be. So our Medicaid match would not be drawn down. We have an MOU with the Department of Healthcare Financing. And so that is trued up quarterly, certainly tracked weekly, but that would not register as an expenditure until the end of the fiscal year.
Okay. Okay, that makes sense. Okay. My clock is ticking down and I don't have a lot of time. I'm trying to find a question that's short. But you know what, Mr. Chairman, are we going to have another round? I see Councilmember Pinto's here, so I don't want to.
Well, Councilmember, you lost some time on this round. So why don't you take it now, okay? And then we'll come back to you for another round, okay? So if you want to finish up your questions that you asked Mr. Neff.
Okay.
Why don't you try to do that now?
Okay. So similarly, at least according to our view, so a reading of the book, in the school-based mental health program, there's a $1.2 million increase in the professional service fee, so as CSG 40. That was not approved, that was not in the FY22 budget, but it appears in the revised FY22 budget. Does that make sense? So it wasn't in what we approved, but it's in a revised. So I'm assuming that there has been some type of reprogramming that has.
So realignment. Yeah.
Or realignment. Okay. Is this part of the efforts to strengthen the workforce pipeline?
I think it was just in the wrong place.
It's part of their contractual services realignment, yes. So I'm not sure what exactly it's going to be used for, but it's probably part of that, yes.
Okay, did you hear Miss Jeter?
She said realignment.
Yes.
Contractual services realignment.
Right.
Yes, from where it was in other services and charges that work could have been realigned from Octa Class 50. We would have to really dig down and get back to you with that, but it's just a realignment. It's not an increase.
Got it. Okay.
Zero.
Okay. I guess that's, well, okay. And there we go. Thank you, Mr. Chairman, for letting me wrap that part up. I have some other questions about CRT and other things, but I see Councilmember.
We're going to do another round, so we can come back
okay.
with some of your issues then. Dr. Basran, I want to go to an area that's I know been of acute interest to you.
Councilmember Gray,
Can you hear me?
joined by Councilmember Pinto.
We'll come back to, all right, we'll come back to Councilmember Pinto now, okay? You want to do a round one by Councilmember Pinto?
I'm ready for a round, but I defer to you, of course, if you like.
No, you take a round now, and then I'll come back with my questions next time around, okay? Go right ahead, Councilmember Pinto.
Sounds good. Thank you, Chairman Gray. And hi again, Dr. Bazran. Thank you very
Hello.
much for your testimony. We talked about, and you mentioned during performance oversight that your team focuses on targeting outreach near our shelters. At what level of support will those services be funded in the current proposal for FY 2023?
Okay, our community response team will be the group that will be providing those services. Just so that you know, the community response team circulates throughout the city, and their job is not simply to respond to crisis, but also to build engagement with the individuals in the community. So when there is a crisis, they can really help them and support them and get them into service. So specifically, our community response team, we have a total of 41 new positions. 27 of those positions will be a part of the basic community response. 14 will be located in the Access Helpline, with 9 of those being co-located at our communications at the Operations Communications Center. So there will be a total of 27 new CRT staff.
Okay, and just so you know, Chairman Gray, you're off mute. Oh, there we go. So in that effort to build relationships in addition to respond to crises, does this budget empower? Everything okay?
No.
Oh, sorry. How does this budget allow your team to build those types of relationships that they need?
I think if we have more staff that are out there in the community, then they are more able to build those relationships and to focus where focus is needed. And so I think that it's all about relationships. And it's all about the people who are there. And we have highly trained members of our community response team that are out there every day and have been out there throughout the pandemic.
And we're so appreciative for all of their work every day. And I know something that we talked about during performance oversight was around staffing concerns and the need to hire these new FTEs.
Right.
For the challenges that we're seeing. Do you anticipate that you'll have challenges identifying qualified candidates? And what do you anticipate the timeline for hiring these new FTEs to be?
Well, it's interesting. The hiring is currently underway, and my staff tells me there are individuals who really love this particular type of work. They really love being out there in the field doing the grassroots community work. And they are currently in the process of hiring up, and they anticipate that they're going to be able to meet their goals. So that's where we are right now.
Okay. I know that both my colleagues here asked about the Sobering Center, but just curious if you can elaborate a little bit once the site is selected and up and running, what the process will look like in getting folks physically to the Sobering Center and getting them the services that they need. How many people will it be able to accommodate? A little bit more details on that would be helpful.
Oh, certainly. So as I said, I'm really excited about the Sobering Center. One of the things that we have looked at is how we can make sure that it's accessible to everyone within the city, regardless of where they happen to be located. And so we have our mobile van that will be circulating. And as you know, that has a full range of services. And and that will move from place to place throughout the city, and particularly focused on hotspots where we know there are people in need. And so if somebody is identified, then they can be literally taken immediately to the sobering center. That's one thing. The second thing is that FEMS will certainly also be still working with us, and they will also be able to transport to the sobering center. MPD will be able to transport to the sobering center, and people will be able to simply walk in to the sobering center if they feel that they need to. So we have ride share, where if a CRT member happens to run into someone and they really need to go to the sobering center, they can either take them or ride share can take them to the center. So we've tried to think through various mechanisms to ensure that this low barrier service is available to people.
Okay. And what are some of the considerations your team is making in identifying the appropriate site?
A part of it is, as somebody mentioned earlier, how much work needs to be done to get it ready. Because, you know, we can't build a new building in a couple of months. So we have to find a site that that certainly will not require rebuilding. That's one thing. The second thing that we will look at is, you know, the ease of getting to the site, and whether or not there will be the availability of space for an emergency vehicle to come. Like if FEMS has to bring somebody, if the police has to bring somebody, we need to have the ability for them to drive in and get the services and supports that people need. Also, the space requirements. We know that we need certain things in the facility to make it functional for the people. We got to have a place for people to sober. We need a place for all of any intake and assessment and screening to occur. We need to have a place for laundry, because we will provide people with clean clothing. We need a kitchen facility so that we can give people something to eat if they're in need of that. And so there are a number of very specific services that will require space. And we want to make sure that all of those conditions are met.
Okay, thank you. Well, we're looking forward for that site selection to happen.
Me too. I'm excited.
Yeah, great. So during DBH's performance oversight hearing a few weeks ago, we heard various credible concerns about mismanagement, insufficient treatment, and supervision of patients at the Psychiatric Institute of Washington. How does this proposed budget propose to improve patient care at PIW in FY 2023?
I think that what you're asking is an oversight and accountability question. And essentially, as you know, DC Health is responsible for licensure of PIW. And there are specific requirements in terms of patient care, environmental care, and so forth that they have to adhere to. In addition to that, DBH has a contract with PIW for certain services and supports, which we also monitor. Recently, our team, along with DC Health, did a joint visit, and we are continuing that process to address any issues. But there isn't an additional budgeted amount.
Okay. Okay. I guess, do you think that there should be additional resources dedicated to improve DBH's ability to follow up on the terms of the current contract?
Well, our Office of Accountability has staff that certainly, in addition to our contract monitors, that monitor our contract. In terms of service delivery, as you know, the stay is a billable service, and we pay for anything over a certain, like if they stay longer than 14 days. But that's really the limit of the additional funding that we provide.
Okay, well, I'm about out of time this round, but thank you very much, Dr. Bazran. Thank you, Chairman Gray.
Thank you, Councilmember Pinto. Councilmember Lewis George, you back with us. So let me turn to you for a round of questions at this point.
Thank you. Thank you so much. And good afternoon, Dr. Bazran. I like that pink on you. I have on red for Delta Day. It was Delta Lobby Day, so I had to put on red for Sheila. But I want to start now. I think some of my colleagues covered some of the school-based mental health questions. So I want to talk a little bit about early childhood social emotional and regarding early childhood services and the Healthy Futures program. And as you know, they did a little bit different things with the budget this time around, so I could just be missing some of this. Can you confirm that the early childhood budget, is it being reduced in fiscal year 23 from fiscal year 2020 levels?
No.
Am I reading that right? Okay.
No.
No. Okay. So it's not, so because what I was reading is that the local budget for early childhood social emotional learning and behavioral health programs will be 2.8 million, which is roughly, I think, on par with previous early childhood intervention investments. And so are we using federal funds, making up the gap from the local funds?
I think so. There has been no reduction in funding for that program, none. And so we have the same funding that we had in FY22. We'll have the same amount of money in FY23.
Okay. Okay. And so how does that square with, I guess, the planned increases in services happening this year to, I guess, 138 child care facilities
Right.
and providing direct counseling to 8 programs and 75 children? Will those increased services and relationships be severed next
No,
year?
they won't be severed. As you know, we have funding for 138 child development facilities, as well as 8 treatment sites.
Okay.
In the budget. And that will move forward in FY23. The thing that I think is important to note is that we're well on the way to getting those services up and running. We have actually hired 8 of the 11 clinical specialists required to support that program, which to me is very good news considering the workforce issues and
Yeah.
And we also, as you know, moving into a child development center also requires a memorandum of agreement with the facility.
Okay.
Working very hard to get those in place. And so right now, we do have, we have 10 additional memorandum of understandings that are in place. That are in the process, and we hope to have those done very quickly. We have 86 that are already fully executed. And so we're moving along the way. And so we hope by the end of the year, we'll have what we need to move forward with next year. And as you know, then we'll have a full year of that effort.
Okay. So how is the agency doing? I think do we have to wait after all these MOUs to staff up for the Healthy Futures program to implement the expanded consultation services?
No, not staffing up, but in terms of service delivery, we have to have a memorandum of understanding with the specific child development center. We can't just go into their facility without their approval. And they've been very cooperative, and we're moving right along with that.
And so I know last time we spoke, you were in the process of onboarding 6 new specialists. Are those 6 new specialists all onboarded?
We have 8 of the 11 specialists are on board.
I love it. Love to hear it. Okay. Wonderful. And then wanted to ask what recruitment efforts and incentives are being leveraged to keep pace with the demand and need for social emotional learning support in our childcare programs?
Well, I think here again, in the Healthy Futures programs, interestingly enough, we haven't had as much difficulty hiring up for that program as we have, for example, in the school-based behavioral health care program. And so, I mean, 8 out of the 11 we've already hired. We only have to go, and so we're doing pretty well there. So I don't anticipate within that area
Okay.
any difficulty reaching our goal. And then I think a lot of people are really excited about the fact that we are going to be putting treatment services in 8 of the centers.
Great.
Yeah.
Wanting to ask sort of why DC Healthy Future, like just about the difference in recruitment and what the issues are with sort of some of the different credentials for, I guess, for clinicians versus other staff. I just want to understand sort of the difference in the like there's different language around who's clinicians and
okay.
The other
a clinician can be a number of different fields. It could be
okay. Go ahead.
It could be a social worker. It could be a licensed an LICSW. It can be a licensed graduate. It could be a marriage and family therapist. And so there's a wide range of people go under the title of clinician. In our school-based behavioral health program, our priority is to have LICSWs, licensed independent social workers. However, we have or LGs or licensed graduates. And the licensed graduates, of course, need to get X number of hours so that they can sit for their boards and then become LICSWs. And that's why we're putting the resources in to provide that supervision. Supervision is expensive. And so that's a real carrot to get those licensed graduates in our program.
Okay. All right. So that's helping me sort of understand what some of that difference is there. And I don't know if one of my colleagues asked this already, so if they have, just let me know. How many students can a DBH or CBO clinician counsel each week? In the sense of providing regular weekly or biweekly counseling?
I don't have the list of how many young people are on whose list. We can get that for you afterwards, but I don't have those numbers.
Okay. Is there a maximum caseload clinicians are recommended to take on for, I guess, patients each week or each month? So like 15 students or 50 students?
I think it depends. Let me get the information for you so that you have a better sense of that.
Okay, I appreciate that. I wanted to see. Sorry.
Go ahead.
I make sure I was looking at the timer. Okay. I wanted to ask something because this is something that's been coming up. How is DBH responding to, I guess, infant and toddler mental and behavioral health needs amidst increased community violence? For example, very unfortunately, in my ward, there have been a number of incidents in the past few months with guns being pulled or displayed near childcare centers along the corridor, or shootings happening very near early learning settings, including during daytime hours. I know parents are in need to support navigating these scary incidents, and I suspect the kids are experiencing ripple effects from the anxiety of parents and educators. What would it take for Healthy Futures or related services to be made available to childcare programs who have experienced sort of nearby gun violence?
Well, I think that we have our school crisis team. So if there is an individual young person or family who need that kind of support, then those teams can be deployed. Our CHAMPS teams can be deployed to support them. The other thing to note is that in some instances, there may be someone who's experienced something and they don't necessarily need treatment services, but they may need help in working through a problem or help in, kind of addressing their mental wellness. And these individuals can call our mental health hotline, which is 1-888-793-4357. And I think I had that on one of the charts. And they can get 3 free visits with no need to sign up, no paperwork, no nothing. And we put that in place during the pandemic because we found that there were a lot of people who were experiencing mental distress who did not necessarily want to enroll in services, but they wanted to and needed services. And so I think that that's it. The other thing that I want to say is that we also have Wellness Wednesdays, which are offered for parents around issues that in terms of helping their young people manage some of the traumatic experiences that they have had, particularly focused on COVID, but also other issues. And so we tried to put a range of services and supports available that were low barrier. People could do that. And then also our community response team.
Yeah.
They are very trauma informed. They provide a range of trauma focused supports, as do our core service agencies. We have, as a result of the 1115 waiver, we now have billable trauma focused support. And so you get whatever you need, quite frankly. And I think that that's good. And we've really placed a major focus on how to deal with trauma. System under Dr. Richard Bebout, who is heading up our crisis services.
Okay. Is Wellness Wednesday available live during like after work hours? So what's happening is we're having instances of gun violence, and like after we'll go canvas, my team, MPD, and Austin Neighborhood Safety Engagement. We'll all be out there canvassing after a incident of gun violence, and sometimes bullets are going through people's homes and it's just severe. What is the CR team the best group to come with us to go to the community who's like sort of dealing with
the CRT is our crisis response team.
So they should, okay.
So those are the people, and unless there is a specific child-related incident, and our CHAMPS team can be deployed. And we, by the way, are adding one additional CHAMPS team.
Oh, wonderful. Okay, great. Thank you. I really appreciate that. I know my time is up. Sorry, Chairman Gray. Thank you.
That's okay, Councilmember Lewis George. We appreciate you being here with us. Dr. Bazaran, I want to address a couple of issues with you.
Did we know how many CRT team?
I'm sorry. The CRT team? What?
No, I don't know where that voice came from. It wasn't me.
I heard a voice. I'm sorry.
I wanted to ask you about the opioid deaths. As you know, Dr. Bazaran, I have spent a considerable amount of time on Minnesota Avenue, where we have so many issues associated with sobriety, with being people maybe having overdosed on opioid. So can you give us a breakdown at this point on where we are with opioid deaths in the District of Columbia? Because it doesn't like it's confined to Minnesota Avenue, but the reality is that we've had a very large number of episodes occur on that corridor. So can you help us understand at this point where we are with opioid deaths in the District of Columbia?
Right, and I think that, Mr. Chair, I think you know that we use the medical examiner's report to verify and determine the number of deaths. There'll be a new report released today, and so we'll be able to give you additional information. It appears that in calendar year 2021, there were 422 opioid related deaths. And so that's where we are. This is a 3% increase over the 411 that we had in 2020. And quite frankly, that's good because the year before there was a 46% increase. And so we're moving in the right direction with the harm reduction activities that we have put in place within the SOAR effort. So we're moving in the right direction this time.
Okay. Well, I'll say that's good information. It's not good that we are continuing to experience the level of opioid deaths that we have. Are you just so for my edification, are you working with the religious community still on an organized way of addressing some of these issues?
Absolutely. The faith-based organizations are key partners. And for example, I think you know Westminster very well. And they have been out there working very closely with us. They were out there with the recent overdoses that occurred on site with us as we were actually not only providing support, but other services to the community. This is very critical to me, that we have contracts and grants with the faith-based community, and we have continued that. One of the things, Mr. Gray, that I'd like to say is that based on the data that we have seen, and we look closely at the data, and we decide what we're going to do as a result of that. What we have learned is that we have to really have a greater focus on harm reduction activities. And that's one of the reasons why we have the Sobering Center. That's one of the reasons why we have increased our naloxone distribution, which is incredibly important. I think I've talked to you about that before. In FY21, we distributed over 58,000 naloxone kits compared to 31,000 the year before. And it's available everywhere. It's available free of charge from our 38 pharmacies, from community-based organizations, and we think that that's real important. So that's one of the things. The other thing I think that's really important is our work in the jail. We have put significant resources in the jail, over almost $8 million of SOAR funds in the jail. And that's to support SUD units there on site. And critically important, the female unit has already opened. The male unit will be opening a little later. In addition to that, we know that when people leave the jail, they are really high risk for relapse. I mean, you know, we all know that. And so we've also done a couple of other things focused with our SOAR dollars. One of the things is that we're providing housing for returning citizens for up to a year, so that they'll have a safe, drug-free place in order to live, as we attempt to use our care coordination services to connect them to the appropriate services within the community. We've also worked very closely, by the way, with DHCF to make sure that Medicaid is turned on immediately when somebody gets out, so that there isn't that lapse. We also are providing care coordination for returning citizens, because we know it's one thing to say, go over there and get your service. Another thing to walk with somebody to get the service, make sure that they in fact got it. And if they didn't like that, we go someplace else. to keep them connected to care. And then we have increased our peer navigator workforce so that we can do it. We're also working a lot with our community, with our other agency partners like FEMS. And one of the things we learned from our data is that FEMS would revive somebody from an overdose, and they would refuse to go to the hospital or refuse to go anywhere. And so now we are pairing our peers so that the minute we hear the peers meet FEMS, so that we can then begin to have direct access to those individuals to try to work with them around their care needs, and at least, getting information so that we can follow up on them. So I think that those things are extremely important, along with the transportation issues that I've raised before, and those resources. We're spending a lot of money, and just to kind of sum up, increasing harm reduction, recovery housing, the mobile unit, care management, prevention services, expanding the distribution of naloxone, our sobering center, our social marketing campaign, and data collection, which is critically important. We got to follow the data, and the data has allowed us to get to this reduction of 3%. As opposed to being at 46%.
Yeah, well, that certainly is improvement. In fact, one of the things that's very important to me is naloxone availability. How are you working with?
Mr. Gray, if I might, I'm sorry. One of the one of the things that I failed to say is that also, you can text for naloxone. So we have the Text to Live program. And so you can text to 888-811 in order to get naloxone. And what happens when you text Live Long DC to 888-811, you get a list of where treatment is available. You're asked whether you want us to drop it off at your house, whether you want to pick it up, or whether you want to go to a pharmacy. And I think these kinds of services are here again, making access much more feasible for most of our residents.
Have you been able to provide, to the extent that is necessary, be able to provide training to a number of our folks in the District of Columbia to be able to administer naloxone?
Yes, we do have, there is naloxone training that is available online, and it's readily available.
Okay, well, that's important. That's an important consideration to me. What I'd like to talk to you about offline, follow up in this hearing, is exactly how the availability of naloxone is occurring through DBH, and DBH is coordinating that. Is that right?
Yes, that's correct.
Okay.
We
But I like
transfer that from DC Health used to be coordinating it.
Right.
As the single state authority, we now have taken over that responsibility.
And we completely agree with that, as you know. I mean, it's part of the health cluster, but I think having DBH coordinating and executing those efforts is far more appropriate for me. So I'm glad that you're doing that, and I do want to hear more about your experience with naloxone, naloxone testing, naloxone administration, et cetera. So my time is up on this round, and we've got Councilmember Henderson. Are you there? Good.
I'm here, Mr. Chairman. How are you?
All right, go right ahead with your round, Councilmember Henderson.
Okay. Dr. Basra, I want to pick up and talk about state opioid response program. Now it looks like, and again, I'm gonna ask this question because looking like for what we have on our side, it looks as though this program will see a nearly $5 million reduction, at least from the budget books. That's incorrect. Okay. We have seen though a $1.3 million reduction on the federal line item for state opioid response.
No. As a matter of fact, I can tell you that we are awaiting so the next version of SOAR, which we have been told is included in the National Omnibus Bill. We do expect to get more money. We have 25.2 million, which is now in our budget for FY23. And what we have been told is that we're probably going to get an additional grant. We don't know what the amount is at this point, but consistently over time, it has been, pretty much around that $23 million level.
Is it possible that your AFO staff can work with the committee here just so we can get some clarity here? Because the budget books and documents that we have show that there's going to be a reduction in FTEs as well under the state opioid program. So, it's hard to have a conversation when I guess we're not operating off the same numbers.
Mr. Neff and Ms. Jeter are going to respond.
Okay.
Yeah, we would be happy to meet and true up the numbers. We just took a moment and looked up the local MHRS that you'd referred to, and we validated that there were $3.782 million expended so far this year, which is would make sense because providers bill every week and we pay claims every week. So we can talk that through and true up.
I think the problem is that they're looking at the budget, where the budget was allocated in 501, but the expenditures are probably in 503 and 506, and we'll work with them to clarify that. That's not a problem.
Okay. Okay. Let's pivot. Let's talk about the new money, or a new investment rather, the $250,000 that you're making to target LGBTQ populations for opioid prevention. Can you talk a little bit about how that population, or how the decision was made to target that particular population with this funding?
Well, I think that if you look at just the data, not only nationally, but also here, what we're finding is a couple of things. One, we're finding depression, suicidality, and other issues are going up in the wrong direction for this particular population of focus, a lot of depression and so forth. And people are using drugs of one type or another to self-soothe. And so I think that's really the basis of it.
Okay. Okay. In particular, what will the funding be used for? Is it more outreach and specialized programs, or?
Yeah, it will be for outreach and engagement in particular, because we have an array of services, but you can have the best services in the world.
Yeah,
if you
nobody knows.
to them, it
Yep.
doesn't really work. So.
Okay. I thought I was moving on from opioids, but I do actually want to draw off something that Mr. Neff talked about, where he said, in terms of the amount of money that has already been expended so far this fiscal year, in terms of the state opioid response, and I think we brought this up during the performance oversight as well. I thought in total you had about $30 million, $30.5 million in terms of state opioid response, but I think he said 3.7 has been expended, or was I confused here? I mean, what we have is 4.8.
Well, the 3.7 was in reference to you noting that of the 10 million and 50, which is local only.
Okay.
We haven't extended any. So that didn't seem right. We looked it up and found that it was 3.782 of that. 10.9 had already been extended. Okay.
But even when we talked to, I would say a month ago, from performance oversight time, FY21, I think we were talking about, you didn't spend all of your state opioid response money.
With
Is this funding allowed to be carried over?
Yes.
Okay. So what's our plan to do better?
No, Actually, we have done better, and a part of it has been making sure that we put some things in place to be able to get through the grant making and the contract making process sooner than we had before. And we've worked very closely with OCP as well as our internal grant management team to be able to do that. And we're doing much better at getting the money out the door. I think that's key.
Okay. Okay. I want to ask about St. Elizabeth's. In the mayor's proposed budget, there was included a 1 million in one-time funding for engineering and maintenance at St. Elizabeth's. What's the planned use for this funding?
Michael?
There's a variety of maintenance projects for the facility, which, as Dr. Bazran noted, is 12 years old. They range from door replacements to replacement of flooring, and some systems that monitor door use and cameras and the number of things to replace.
Okay, it was in contractual services. Is this so you will I guess the question I'm asking is, will you be looking to DGS for assistance around this maintenance, or are you contracting out separately?
We'll likely contract out. It's because it is 41 money.
Okay. 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 So when we look at the data historically, we haven't always, the 1 million stands out because historically speaking, we have not budgeted that much amount of money for St. Elizabeth's under the maintenance line. So is this just, hey, there are a lot of deferred maintenance projects that we need to knock out for the facility, and that is why we're seeing such a significant investment at this point?
Yes.
Okay.
Yes.
Okay. All right. So, oh, I've got some more time here. This is so great. Thank you. So in the policy planning and evaluation division, it houses the Training Institute, or at least that's what it looks like in terms of our budget book. Can you talk about some of the work of the Training Institute?
Oh, yeah. Our Training Institute provides a wide array of training on evidence-based practices, best practices that help support the delivery of services. We actually have an LMS, a learning management system that actually tracks the person who takes the training, whether or not they have met the requirements, and actually they can get a certificate in terms of that training effort that can be used for CEUs for those courses that are CEU eligible or CME eligible. We put this in place several years ago. I'm very proud of our Training Institute. It is critical to ensuring that we can provide the most effective services for the people we serve.
Okay. So, and again, we can have this conversation, but what we're showing on our side is that there was a reduction in the Training Institute budget.
What? There are lots of reallocations of between numbers. Michael, and go ahead.
The major difference there is that the reporting and performance management staff were previously a part of the Training Institute, and those FTEs have now been moved. So that
Okay. And where did we move those FTEs to?
it is data and performance management 6701, moved from 6703 Training Institute.
Okay. Okay, so it was just a move in between the lines. Got it. Oh, and I'm over my time now. Well, I'm out of time now. Thank you, Dr. Bazran. Thank you, Mr. Chairman.
Thank you very much, Councilmember Henderson. Let me go back to the questions. There was an interesting discussion about the St. E's, which is now 10 years old, I think. It obviously was built 10 years ago. But is there anything involving St. E's, Dr. Bazran, that might still be under warranty that could be potentially covered? Because of the fact it was not built yesterday, but there are lots of things that have been built here at St. E's that will, to me, potentially still be under some level of warranty. In fact, one of the things I wanted to ask you, which is related, and that is, how will the new hospital that we're building, how will it be related in terms of providing behavioral health services for people who live in the District of Columbia?
Well, the first question is about whether or not there are things that are under warranty in the existing St. Elizabeth's Hospital.
Correct.
And at this point, I'm not sure what we have that's still under warranty after 10 years, but we can follow up and get that information to you. I don't know. I think after 5 years, most things are out of warranty, so I'm just not sure.
Okay, can you follow up and let us know, Dr. Bazran?
Absolutely, we can
They
follow
still
up.
be covered, yeah, okay.
In terms of the new hospital, I think you know that a lot of the specific services are still under discussion. I have been discussing the behavioral health services along with Deputy Mayor Turnage. We do know that they will have at least 10 beds for individuals who who have psychiatric needs, who to be committed. We also know that there will be other services in another building on the campus. And we're still working out with what those specific services look like. Here again, we're following the data. What are our gaps in services? What's needed? And then what can we add to that campus? Here again, as you said earlier, to make sure that there is a system of care as opposed to a hospital.
Right. So that, is that being worked out with UHS, or how is that being? Okay.
Yes, it's being worked out with UHS and the deputy mayor.
Okay, and how is that, how are those discussions unfolding at this point, Dr. Bazran?
Well, we've had discussions, and our discussions have been very collaborative. And so we'll continue to do that now that, you have actually had the groundbreaking, and we know that the hospital building is underway. And so the city mayor is really working hand in glove, as you know, within that effort. And I am working with him around behavioral.
And those are including, you say they're including behavioral health discussions, and how are those discussions, how are they being looked at this stage in terms of responsibility for certain services? Because it may be that there were certain behavioral health services will be provided in the new hospital, and if they are, how are they? What is the discussion around that?
Well, we actually have a meeting coming up, I believe in like a week or two. We're going to have some further discussions. And so I'll have a better sense as, we continue our discussions.
Okay. Well, maybe I should follow up with the deputy mayor or, with Mr. Turnage about how these discussions are unfolding, because I'm obviously very interested in this issue. Obviously myself, and want to see exactly how it is that the pieces are fitting together. How do you envision, from a behavioral health perspective, these pieces fitting together, Dr. Bazran?
Well, I think here again, as I said, we need to look at what the gaps and needs are in our delivery system, and how those gaps and needs can be filled on the new campus. And then what the relationships, the interrelationships are between the existing St. Elizabeth's, the new hospital, and the other urgent care and services that are going to be available there.
Right. And there will be urgent care services provided in relationship to the overall system that's unfolding as well. How do you envision St. Elizabeth's as a healthcare facility being able to integrate its services with the new hospital system that's being created at this point?
Well, I think St. Elizabeth's has a very specific function.
Right.
Is our state hospital responsible for forensic services and for those people who need inpatient ongoing psychiatric care. And so I would imagine that we certainly would have a referral relationship at a minimum. If somebody goes into the new hospital and they have stayed for more than 14 days and they need continued care, then I would imagine that those individuals would then be referred to St. Elizabeth's. At the same time, we have people at St. Elizabeth's Hospital who may need physical health care. And remember, I talked about whole person care as one of the things that I'm very focused on. And so somebody at St. E's who may need physical health care, well, you have a facility right there. And so they don't have to travel, across town or something like that to get that care. As you know, our population is aging, and unfortunately, for some aging people, they have increases in medical needs, and therefore, I'm glad to have that resource readily available there.
Yeah, I agree with you there. There've been several events, as I'm sure you know, of course you know, in the last year that have compromised the safety and the security of both patients and staff at St. E's, including a homicide that occurred just a few weeks ago. What measures are being funded, being taken in this operating budget that will address some of those issues, Dr. Bazwan?
Well, there aren't any specific funding things that are included in this budget. But first of all, I would like to just say and provide my condolences to the Dowdell's family. Our hospital staff, we have met with the daughter, and we do express our sincere condolences and have offered the any support that is needed in terms of addressing this traumatic event. We also, though, within the hospital, as you know, maintenance is extremely important. I think you know that we have things underway to replace, like some of the door locks, the security cameras, the fencing, and so forth. That's all a part of our maintenance effort and needs to be ongoing. And so that 1 million in new maintenance will do that kind of protection. Internally, as you know, there are certainly investigations underway, and both by DC Health as well as DBH. And there's a criminal investigation. And so at this point, that's about all I can share on that.
Okay. Would you keep us apprised of how this continues to unfold? Because you're right, it is a critical issue, to say the least. And we want to make sure that, we're following all the policies and procedures extant at St. Elizabeth's. So having that availability of information from you will be very important. We're asked at times, as you know, you're asked, and we want to be able to coordinate with you, whatever information is going to be provided to people and what kind of follow-up is being provided. I mean, this most recent incident was, it sounded like somebody was in the jail and then was at St. E's and supposedly, allegedly, I'll put it that way, was engaged in an assault on someone. So thus far, and I realize the investigation is probably ongoing, but thus far, can you tell us where we are with the information on that allegation of what happened?
As I said earlier, a criminal investigation is underway, and so at that point, I'm not able to say anything else other than what I've told you.
All right. Who's responsible for the investigation at this point, Dr. Badron?
In terms of MPD?
Well, yeah, is it an MPD investigation? I'm just not clear about who at St. E's or, in our system,
Our
who's
office,
responsible for this?
DC Health is responsible for the investigation. And then we also have our internal investigation, which includes the hospital as well as our Office of Accountability and, of course, the police department.
I see. And so who would we, if we're trying to find out something about the investigation, would we connect with you at this point? Somebody with MPD we would connect with? Somebody other than I just mentioned in this constellation of people? Who would we connect with to get information on this situation at this point?
Well, I think whatever is publicly available comes from MPD.
Mm-hmm.
At this point, whatever is publicly available, we can certainly share, but it's very limited at this point.
Okay. So we should connect with Chief Conti. Is that correct?
If you want to know about the criminal investigation.
Yeah, and the process associated therewith, but in this instance is a specific incident that we're talking about. So that can be used for me anyway as an illustration of the dynamics of how these things are continuing to unfold, especially when you're involving MPD and, and the correctional system at the same time. And maybe you or may not be you, I don't know. You would know better than me about that.
That's about all I do, as I said, it's.
Okay, well, we'll talk to Chief Conti about the issues that are involved in this, and we may wind up coming back to you with additional questions as well.
Yes, sir.
I know, just to return to the security issues with St. E's, they've been for a while pronounced on various occasions. So can you share with us how those security issues are being addressed at this point and what changes have been made? I know we had somebody that at one point just walked away from I don't know how in the world somebody can do that at St. E's, but they did. Walked away from the situation. So can you share with us how those issues are being addressed at this point? And what has happened in the past?
Certainly, and then also I do know that our CEO is also online and can share additional information. But as you know, the security fencing was an issue. We did look at that and make some replacements. We also replaced the key system for entry to the various units so that that's more secure. We do have cameras that are focused and are monitored throughout the day 24/7 that are available. We have security at our entranceway And they not only check people coming and going, but also monitor 24/7 throughout the day and night. And we've also done extensive training of our staff to ensure that all of the safety procedures are being followed.
We probably will have some additional questions that I'll get to you. I don't know if additional council members will have additional questions, but we may. In last year's budget, there was allocated $6 million to avert certain 911 calls to directed to the community response team at St. Eve's or at DBH. Can you provide some information
Sure.
on how we can address that?
Sure. First of all, I think you're referring to the pilot, the 911 pilot.
Correct.
That for the Office of Unified Communications. The pilot ran from June of 2021 to February of 2022. And it ran from 6 a.m. to 6 p.m. And the goal was to send those calls that came in through the 911 line that appeared to be related to someone who was in need of mental health services to our Access Helpline, as opposed to sending those calls to the police. Now, we had certain caveats around that. And so calls where there appeared to be a safety issue were still sent to the Metropolitan Police Department. But if it didn't appear to have a safety issue, then they came to Access Helpline that attempted to resolve them on the phone, provide the support that the caller needed. And then if not, a hot link was made to our community response team, who then was deployed to the scene. So we learned a lot during the pilot in terms of the protocols for defining the types of calls, for example, that should be sent to us, for looking at how we're defining a low threat call, for example, that would come to us, and that criteria. And now we are poised at a position where we are able to move this program to 24/7, effective March 31st. We also are hiring up 14 new Access Helpline staff and 27 new CRT members, and we will have 9 staff co-located at the Office of Unified Communications to work hand in hand with the callers there. This is really exciting, because this here again makes sure that people get the right service at the right time from the right provider, and that they aren't automatically sent to MPD or to FEMS, but rather to somebody who can provide the mental health support for them. So that's one of the things. The other thing that we've done is we have, at the mayor's direction, we have expanded the training for the Metropolitan Police Department for our officers. We now are offering at least one CIO training per month, as well as a 20-hour refresher course and a 20-hour mental health first aid course. The goal is to provide information to our officers that are out there on the street in terms of, how you might interact most appropriately for someone who is having a mental health crisis concern. So I think that that's what we're doing within that program right now.
Okay. I see that Councilwoman Henderson has returned, and I want to give her a chance if she has another round of questions that she wants to shoot. Yeah, give her a chance to do that. Councilwoman Henderson.
Thank you, Mr. Chairman. Director Bazran, I wanted to ask, so I sort of asked this, I guess, beginning last week with the budget director, Jenny Reed, and the city administrator about the line item in the budget that's now referred to as district recovery plan. And I think Jenny told me last week, this is ARPA funding. They wanted to have it clearly marked. And so what I think might be happening is there's some areas in your budget or the way the budget book is laid out where there are reductions and then they're using ARPA money to do the local replacement.
Absolutely, yeah.
Okay, do you guys have some type of crosswalk that you can share with us, or some type of spreadsheet, something that outlines how your district recovery dollars are being plugged into the various programs? Because I think that might help resolve some confusion.
Okay, an ARPA crosswalk, we'll get that to you.
Okay, great. And then the only last other thing, because I didn't know that the chairman was going to give us another round, so I was, was about the community response team. Are you all adding FTEs to this program?
Yes.
Okay, so how many will there be total in FY23?
In FY20, the total number, I have to add up all of them. I think it's 80 some, but I have to get you the exact number because we're adding 41.
You're adding 41 for FY23.
Well, there are 41 staff. 14 are going to go to the Access Helpline and 27 to the CRT.
Okay.
To the street. Okay.
And these are new people?
These are new people.
Okay. Given the conversations around hiring, et cetera, how confident do you feel in terms of being able to fill these positions in particular?
Well, what I've been told from my staff is in terms of the CRT staff, they seem to be feeling very positive about hiring. People seems to want to have those jobs, but it could be difficult. I can't predict.
Okay. Okay. I'm just trying to, I feel like there's lots of, well, you have all
But I
kinds
have
of
to
people
tell
who
you, I'm
work for
concerned about hiring licensed staff, just generally.
Right. And so I guess to that point, what is the conversation that you are having with your colleagues across the cluster around how we can better, I don't want to say compete here, but like, what's the solution here? Do we have to grow more of our own? Do we just have to like hang on to more of the folks who come here to study and they do their clinical research, et cetera? I feel like this is one of those, I can't just meet somebody on the street and say, hey, do you want to be a social worker?
No, you can't. No, I think that certainly hiring clinicians is a challenge. And I think it's a challenge that not only we've experienced here, but when I talk to my other state commissioners around the country, we're all kind of faced with the same challenge. And so what we have to do is the kinds of things that we've put into our budget for school-based, and that is, how do we get more people in the pipeline? How can we connect with our universities around training, internship programs? How can we make it more attractive by doing things like making sure that supervision is available, or making sure that money for licensure is available, making sure that money for CEUs is available? I think those are the kinds of things that will attract people to our program versus Maryland's program, for example, or Virginia's program, because we're all really kind of taking people from the same pool. And, if St. Elizabeth's Hospital, they have a very, very well organized and well-run program for psychiatrists. And their psychiatry training program has really allowed us to get psychiatrists into our system here. And so if we can learn from that experience, you know, building that pipeline and getting people into that pipeline can yield positive results for us because it has through that St. Elizabeth's training program.
Right.
Mhm.
Do you all do student loan repayment as an incentive?
One of the things that we're doing is we are connecting our CBO clinicians, for example, to the loan repayment program at DC Health. We don't have our own.
Okay. Okay. Because I'm sort of thinking like,
Yeah.
you know, as we're having this larger conversation in terms of
Sure.
government, and we have this issue of like, okay, we need more people to even want to choose this as a profession.
Correct.
We have programs, not run through your office, but run out of OSSI, right? That provides scholarship assistance, et cetera, around certain majors. But the thing that's different is that, like say, for instance, DC Futures, it's a great opportunity for Catholic, Trinity, and UDC, but it has to be the first degree that you're receiving.
Correct.
So if I already have a bachelor's, but I want to make a career change, if I want to, and if I feel like my calling and vocation is more in social work ministry now, DC Futures isn't available to me, but I might be the exact type of person that you want. Right. In terms of having prior work experience, a clear vision in terms of a commitment to the work, but now I have to take out X amount of student loans in order to make it happen. And so perhaps we need to be thinking about not just those who are at the beginning of their career path, but those who might want to do a career change going forward. So perhaps we should talk more about that. But those were the questions that I have for right now. I saw Councilmember Lewis George peak, and maybe she'll be back.
Hey, Councilmember Lewis George, back also, Councilmember Henderson, and you talked about loan repayment. There is a loan actually established when I was a council member the first time. It's a loan repayment program we established, and we do have it funded through the Department of Health at this point. So what I think would be helpful is if we can work with Dr. Bazran to see if there are some connections that can be made, that should be made on behalf of people who are, you know, in her system that could benefit from the loan repayment program.
Yeah.
So we'll be happy to work with you on that if you want to do that.
That'll be awesome. That'd be great, Mr. Chairman. Thank you.
Okay, thank you. Louis George, are you there? Maybe not. Thought she was back with us. Well, I tell you what, we will follow up with you, Councilmember Henderson, and Dr. Bazran to see what connections we can make between the existing loan repayment program, especially since they should be interchangeable from one system to the other. We're talking about some of the same professions without question, and we ought to be able to recognize an opportunity that exists, you know, in our own government for these opportunities to be made available to people. So I'll work with you and Dr. Bazran, Councilmember Henderson, to be able to make that connection. Okay.
Thank you, Mr. Gray.
Welcome. Okay. All right, and I think Councilmember Lewis George will not return. She may have other issues. If she has other questions, we'll be happy on the committee to be able to follow up as well on that behalf. And Dr. Bazran, I want to thank you for being with us. You've been wonderful to work with these last almost full 4 years, right? And, I appreciate your efforts, and we'll be looking forward to continuing to work with you. I want to work with you and it's Councilman.
I'm going to hand it over to Jessica because Jessica has been working very closely with her.
Sorry, I am on my round with Councilmember Bonds in the DACO hearing.
Yes, thank you for that question.
Literally right now. I heard you call me, so I guess I won't be able to get my round in.
But I will give you. How about?
Let me just say, I'll say a few things. One, Dr. Bazran just asked if you could consider housing, loan forgiveness, signing bonuses, higher salaries as solutions to solving our pipeline. Just being able to add those in as ways for us to deal with this retention problem. I think those are loan forgiveness and housing, maybe be the biggest two, but signing bonuses and higher salaries, I think needs to be an emphasis there. And then the other space was with the CRT teams. I think if we could do some ward-based CRT teams, expanding it enough so each ward gets their own crisis team, that would be great. Also, I think I know the numbers increasing, but if we could do like a ward team, that would be helpful. All right, I gotta hop off. Thank you.
Thank you.
Thank you, Councilmember George, Lewis George. We appreciate it very much. And I don't think we have anything else right now, Dr. Bazran. I will follow up with you the discussion that we had with Councilmember Henderson about the loan repayment program, so we can see how the connections, because there should be a way to make a connection one agency to another. It just would seem ridiculous to say that we got the same experience over here in this agency, and it should be transferable to another agency, in, let's say, DBH. In this point. So I will follow up with Councilmember Henderson with you, Dr. Bazran. I want to thank you for your continued work in the nearly almost 3 years that you've been back with us. And I've certainly I don't have a reservation saying it, but I've enjoyed working with you on your return to the District of Columbia. I will say, without reflecting on the you people of the past, I really am sorry that you got the first time. You should have been. I wish you'd been appointed had you been interested at that point. But you know what? You're back here now. I think you're doing a good job, an excellent job, and we'll look forward to continuing to work with you on some of the issues that have been raised in the budget. And I appreciate you. So, thank you so much, Dr. Bazran, and we will continue to work with you, continue to work directly with you. And that having been said, this hearing is now adjourned at was it 4:22 p.m. on the same day that we started. Thank you much. We're adjourned.
We've gone with all night long.
Mm-hmm.